Good afternoon. Welcome to Senate Finance. Today is Tuesday, March 7th. We have 12 bills that we're going to be considering before the committee today. We'll consider the bills in the following order. Senate Bill 729, 696, 506, 604, 772, 774, 801, 479, 581, 582, 699, and Senate Bill 804. To our guest, we will have our sponsors present the bills, and then each of our witnesses will be given 2 minutes to provide testimony. We do have a number of bills and witnesses signed up today, so we ask that you be mindful of the time clock that will sound when your 2 minutes have concluded. You may see members in and out of the hearing today. Please know that they have bills that they're presenting in other committees. They mean no disrespect to your testimony. If you see members leaving during bill hearings, they likely have presentations in other committees and will return as quickly as possible. So with that, we're going to start with Senate Bill 729, which is the State Board of Nursing Sunset Extension. I have Karen Evans and Secretary Laura Herrera Scott. Good afternoon.
Good afternoon.
You can get started as soon as you're ready.
Still waiting to see you in person, actually. So, good afternoon, Chair Griffith, Vice Chair Klaus Meyer, and committee members, Secretary of Health, Laura Herrera Scott. I'm here to respectfully request this committee's favorable consideration of SB 729 as amended. This is a departmental bill that extends the Board of Nursing statutory and regulatory authority. The Maryland Board of Nursing licenses and regulates over 200,000 Marylanders that are the backbone of our state's healthcare delivery system. As such, the nursing board makes up about half of the roughly 400,000 total health occupation board licenses in Maryland. As introduced, the extension is for 3 years to 2026. Upon further review, MDH recommends amending the sunset to align with 2025 sunset outlined in HB 611. Which passed the House unanimously on February 16th and allows MDH to work with and support the Board of Nursing to improve their administrative and infrastructure operations. Similar to the General Assembly's interventions with the Board of Physicians, MDH believes this will improve the board's administrative processes moving forward. Aligning the board sunset date will allow for the provisions of HB 611 to be completed and for the board and MDH to return to the General Assembly with an update for the next sunset extension. Thank you.
Okay. Good afternoon, Madam Chair, Vice Chair, and members of the Senate Finance Committee. My name is Karen Evans. I'm the Executive Director for the Maryland Board of Nursing. Thank you for allowing me the opportunity to testify on behalf of the board in support of Senate Bill 729. The board has been, I don't want to repeat what Secretary Herrera Scott stated. So the board has been subject of numerous studies during the 2021-22 interim periods. These reports reintroduce operational, informational technology, staffing, and funding challenges that have persisted over time. The board is supportive of the 3 years sunset extensions as it would allow the board in partnership with the Maryland Department of Health and other stakeholders to implement an action plan to address current inefficiencies. The board believes the 2-year extension would not yield tangible results and would not allow for an adequate transition period as the action plan may still be in progress of implementation. Thank you again for the opportunity to testify on behalf of the board in support of Senate Bill 729. I urge the committee to submit a favorable report. I would be happy to answer any questions committee may have.
Thank you very much. Senator Lamb.
Thank you, Madam Chair. Thank you to the panelists. This question is for the Secretary. You cited two different bills here. There was the House Bill 611, which I think is now actually sitting before this committee because it's come over from the House. And this bill that we're talking about, which is Senate Bill 729. 729 just does the date change for the sunset
Okay.
extension. 611, the House Bill 611 does quite a few other reforms that are probably important to the Board of Nursing. Is there a preference between these two versions of the bill? Because they're a little bit different in terms of, the size and scope of what they're doing here.
So that was my mistake. I didn't realize there were two different bills. I thought they were one and the same, and it was the crossover. So, for sure, we're still in favor of the shorter sunset because we are trying to do the deep dive into the board and some of the administrative, as was already called out, inefficiencies and how do we support the Board of Nursing, because our ultimate goal is to serve the licensees who need their licenses to practice in the state of Maryland. So just taking the bill that you just mentioned, the shorter extension, shorter sunset, so we could come back to you and give an update on what we've done to address those administrative inefficiencies.
So but you also support HB 611, which is now sitting here too, right? I think when it came over from the House, you were supportive of that. Would you be open to, since you're supportive, I guess, of both these bills, and one is really kind of a subset of the broader 611 bill, would you be open to amending 611 into this bill, 729?
I'm open to the best path forward. We do have some history having done this with the Board of Physicians where we stepped in and helped get them straight and then turned back control over to the Board of Physicians. And, is my understanding is based on the numbers that I'm looking at in the MFRs that they have been doing a good job post this review and administrative assessment and changes. Yes.
Okay. All right. That's helpful. I just noticed that they were similar, but that clarification is helpful. Okay. Thank you, Madam Chair.
Thank you, Senator. Any additional questions? We thank you both for your testimony, and Madam Secretary, we are overdue for a face-to-face. I look forward to meeting with you in person.
Thank you.
Excellent. Thank you very much. And there are no additional witnesses signed up for this bill. So that will conclude the hearing on Senate Bill 729. We'll now turn to Senate Bill 696, which is the Prince George's County Gateway Arts Development Authority. Senator Augustine, good afternoon.
Thank you, Madam Chair. I should be joined here by Mayor Casañas and hopefully Mayor Benitez. If she is not available, we obviously will proceed. Senator Malcolm Augustine here on behalf of Senate Bill 696, Prince George's County Gateway Arts Development Authority. Colleagues, this is a local bill. The bill establishes Gateway Arts Development Authority in Prince George's County to support the development and approval of a comprehensive neighborhood revitalization plan in the target area within my county for an arts ecosystem and helping it to really thrive. We have a naturally occurring arts community in this part of District 47. The artists really came to the area that was at the time was the most affordable, sort of like in the region. And so it's a place where the artists have come. They are there. They have their workspaces there. They also have the places that they live there. They transformed abandoned warehouses into just these really amazing art spaces. And that's where their work is. And that's also where they're able to show that. It's really, it really is a wonderful natural occurring arts community, but it is on the border with Washington, D.C. And that border of Washington, D.C. has the prices of the real estate and things across the border in Washington, D.C. has just gone absolutely through the roof. I mean, it's just way through the roof. And that has rolled over to a certain degree, not into actually activity in our area, but it actually has created a situation where we are not getting activity in our area. We have a significant number of the property owners who are basically sort of sitting on the property, hoping to kind of hold out for some future big payout. And we're worried. We're really worried about our folks getting pushed out. We think that, you know, this is something that's important to the state, that we support arts, we support a place for their homes, and a place for them to be able to work together. And so what we did was we pulled together the 6 municipalities that are all amongst this group, to try to get a group that really can make some sense, because amongst the 6, it gets to a total of 25,000 folks within those 6. And bringing those folks together, the hope is that through this authority, we'll be able to create this, hold on to what we have, but build also onto where we can go in the future. Now, there's still some work to do on this, I will say. I'm working with my colleagues in the Senate, Prince George's delegation, where we will get ourselves together on that, Madam Chair. And I've talked to some of the folks of that, and we're working on that with regard to changing the name. I've also been in touch with the chair, not the chair, but the economic development team for Prince George's County. And we are working together on some of the structure to make sure that this is the most successful that it can possibly be. And so with that, I will ask for a favorable report on Senate Bill 696. Good Mayor.
Hi, good afternoon, Chair Griffith and members of the Finance Committee. My name is Monica Casañas, and I'm the mayor of the town of Colmar Manor. I am here to testify in support of SB 696. The town slogan of Colmar Manor is "The Little Town That Can," and for nearly 100 years as a historic port town, we have weathered economic downturns, demographic shifts, and environmental challenges. We have one of the highest tax rates in Prince George's County, and the expectations placed on municipal government make developing comprehensive plans, affordable housing solutions, driving economic development, or creating transportation plans difficult. Our region suffers from aging infrastructure, a lack of cohesive planning, and slow economic development. A development authority is the catalyst our community, as well as our neighbors, need to contribute to the demands of a 21st century workforce and join in the region's burgeoning economic and physical development. As an entry point into Prince George's County, we want to be the first touch point that represents the quality of life, business, and recreation that our county offers. Our corridor is positioned and ready to be the gateway that shows the innovation, dynamism, and economic possibility for the region. Is that normal?
No.
Okay. Okay, I thought it was lights telling me to like cut it. Anyway, sorry. The Gateway Arts Development Authority, with the inclusion of the town of Colmar Manor, will greatly assist our town and our neighboring communities. These communities represent underserved residents of color, a diverse immigrant population, and some of the oldest communities in Prince George's County. The authority will provide us with tools to create a comprehensive neighborhood revitalization plan that will benefit residents, housing, economic development, neighborhoods, and transportation. The passage of SB 696 will be critical for the growth and development of Colmar Manor and our neighboring communities. We urge you to support this bill and invest in the future of our town and the Gateway Arts District. Thank you for considering my testimony.
Thank you very much. Are there any questions for the sponsor or as witness? Vice Chair?
Yeah, I would just like to know, how long has it taken to get to the point of where you are, where it's been so successful?
You mean like how long have artists been in the
Yes.
region? Oh my gosh, they've been there for a very, very long
okay.
time. I mean, they because of the warehouse district, and they found that. So we have like longstanding folks who have used those warehouses that were abandoned warehouses. So it's been 30,
Okay.
years that those have been there. And so they came there because they were relatively affordable. So it's been there for quite some time, Senator.
No, because I have the same kind of thing that I'm trying to start up in my district, but
We've been there for a long time.
very slow coming.
It's hard. Well, we're already there. And so that's what we're trying to make sure we keep it. I mean,
Yes.
that's what it's about.
Okay, thank you.
Yes.
Thank you. Any additional questions? Seeing none,
Okay.
thank you very much for your testimony. And Senator. Okay, Senator, you mentioned the other mayor was not available. Is that right? Mayor Benitez?
Yeah, I don't see her.
Okay, well
Thank
then, thank you. That will conclude the hearing on Senate Bill 696. I see Senator Muse has come in. So we will go to Senate Bill 506. And that is Town of Forest Heights, Prince George's County, Urban Renewal Authority for Blight Clearance. Good afternoon, Senator Muse.
Good
And
afternoon.
if you have a panelist, you can feel free to bring them forward.
Thank you. We do have a panel. Councilman Troy Lilly from the town of Forest Heights, and Mayor Washington has submitted a written testimony. First to you and to Vice Chair Klaus Meyer. This was a wonderful committee I served on for quite a few years. So it's good to be back in this committee. I hope that this is the easiest bill you'll hear today, because I know all of the tough ones that you have in front of you today. But this would simply, SB 506 rather, would grant one of my, in fact, my only municipality, the town of Forest Heights, the authority to exercise urban renewal powers for use for blight clearance and redevelopment. They will be able to acquire and repurpose and or hold and sell vacant and blighted properties. Prince George's County has had this power for over 50 years, and 18 municipalities in Prince George's for 50 years, and 67 municipalities throughout the state, 50 years. And let me give a good example. In Forest Heights, as you'll hear, there's an old school, elementary school. It's been vacant and deteriorating for more than 18 years. And this bill will allow the town of Forest Heights to acquire that property and to move ahead with revitalization that is badly, sorely needed in that area. We do have, we did take a vote in delegation. I do have a delegation letter. It is local bill. And we have, so for that reason, you'll hear from our esteemed council person. And I'll stop with that and hope for a favorable report as well. So thank you, Madam Chair. Thank you.
Good afternoon, Madam Chair and esteemed members of the Finance Committee. My name is Troy Lilly, and I'm the Council President of the town of Forest Heights. I'm here today to testify in support of Senate Bill 506, and I would like to thank Senator Muse for introducing this important piece of legislation. We support this bill with the amendment to add the word residential to the bill's language. This will clarify that residential and non-commercial zones, which represent almost 90% of our town's landmass, are included in the legislation. In Forest Heights, we have seen an increase in blighted properties, which are impacting our community's safety and quality of life. This bill will give us the tools we need to address these issues and take back control of our neighborhood. In particular, as Senator Muse mentioned, there's a dilapidated commercial building near the entrance to Forest Heights Elementary that has been abandoned for more than 18 years. Children pass this building every day on their way to school, and the property is fenced off and has accumulated trash and debris in its parking lot. This bill will give us the flexibility to sell the property to private parties who can efficiently repurpose the blighted property for reuse. Furthermore, the bill requires the town to pay fair market value for any property it identifies as blighted, similar to other eminent domain laws. This ensures that we are being fair and equitable in our efforts to address blight in our community. In conclusion, we believe that this bill, with the proposed amendment, will be a vital tool for the town of Forest Heights to address the issue of blighted properties in our community. We urge the committee to support this bill and help us with revitalizing our neighborhoods. Thank you for your time and attention.
Thank you very much. Senator Vital has a question for the sponsor or the panelists.
I think,
Okay.
council member,
Council President, ma'am.
council president, thank you. I just wondered, I really respect and admire your work in revitalization. I have an area in my district that we're working on too. And I wonder if you have reached out to Secretary Day or DHCD for some help.
Well, that's a great question. I talked to Secretary Day just a couple weeks after his appointment was officially announced. We plan to have Secretary Day come to the town and do a tour just to walk the streets and to see firsthand the issues that we're dealing with. And so, yes,
That's perfect. We,
yes.
my community's gotten some help from that department, so I hope it goes well. Thank you.
Thank you, ma'am.
Thank you, Senator. Any additional questions? Seeing no further questions, we thank you for your presentation and your testimony. I have no additional witnesses signed up on that bill, so that concludes the hearing on Senate Bill 506.
Thank you very much for your favorable report.
Thank you. He said it was be easy. All right. Colleagues, we're going to turn to Senate Bill 604, which is a Maryland Medical Assistance Program, provider agencies, personal care aides, reimbursement and wages. Senator Benson's bill. I understand she's voting in budget and tax. So her legislative director is going to present the bill. Is Chloe Williams here? Okay. Thought she was here. Gotta know. If she's not here, we can move to the next bill. All right, we're gonna move to the next bill. Senator Lamb, you ready? Is it a long bill? Oh, wait. I think she's here. I think she's here. Okay. Oh, that was a short one you had. Okay, so we're gonna go ahead and proceed with Senator Benson's bill, Senate Bill 604. Is that, are you Chloe? You would present from that table back there. Okay, thank you very much for coming and did you have a panel you wanted to bring up with you?
Yes. It's right
You can
Thank
get
you.
started as soon as you're ready.
here. All right. Just
Wow.
want to start off
The
by
whole
saying,
witness list is the panel. Okay,
yes, the witness list.
okay, very good. Thank you.
I just wanted to start off by saying good afternoon, everyone. The Chair Griffith, Vice Chair Clausmeyer. Can you hear me better now? Okay. I just wanted to start off by saying good afternoon, Chair Griffith, Vice Chair Clausmeyer, members of the Finance Committee. I'm here to present SB 604 Maryland Medical Assistance Program, Provider Agencies and Personal Care Aides, Reimbursement and Wages. This bill requires the Maryland Department of Health by July 1st, 2024, to increase the hourly reimbursement rate for personal assistance services provided under specified medical, home, and community-based services to a minimum of $25 per hour. Beginning July 1st, 2024, a provider agency must pay a personal care aide a specified wage. A provider agency must provide written notice to each PCA about the wage increase by September 1st, 2024, and annually thereafter, a provider agency must provide a specified cost report to MDH. MDH must develop a process for a PCA to report provider agency failure to comply with the wage increase. And lastly, MDH may take appropriate enforcement action against a provider agency for specified actions. At this time, I'd like to open up the floor for any questions.
We'll go ahead and hear from the panel and then we'll do questions.
Great, thank you.
Thank you.
Good afternoon, Madam Chair, Madam Vice Chair. My name is David Rodwin and I lead the Public Justice Center's Workplace Justice Project, and we thank Senator Benson for introducing this bill. This bill is about addressing the home care workforce crisis that we have in Maryland. And I'd like to start just by pointing to 3 data points that are in our written testimony. First, Maryland's demographics are changing. Our state's getting older. There is a chart in our testimony showing the percentage of the population 85 and older projected to increase by about 180% over the next 25 years. We do not have the care workers we need to address these demographic changes. Second, a recent study done in the District of Columbia showing that 70% of the district's care workers, home care workers, live in Maryland. That's because the District of Columbia has a living wage requirement for home care workers. They're already required to be paid over $16 an hour. Maryland's home care workers go to DC to work and earn enough to live. Third, a recent study found that Maryland ranks 49th out of 50 states, the second worst in the country, in the difference between home care workers' actual wages and what's needed to attract and retain enough workers while paying workers enough to live. This bill seeks to address these issues by doing two things. First, it increases the Medicaid reimbursement rate. Most home care provided in Maryland is funded by Medicaid, so it's the single most important tool to affect these workers' job quality, from $23 an hour, where it currently is, to $25 an hour. Second, it requires that these workers paid with Medicaid funds, public dollars, be paid at least $16 an hour. Is that a living wage? Frankly, I don't think so, but it's something closer to what they're earning now, which is about $14 an hour. On an ongoing basis, it requires that these workers be paid at least 64% of what the state pays the home care agencies for the care. And with that, I'll ask for a favorable report. Thank you so much.
Chair Griffith, Vice Chair Klausmeyer, Eric Cultramiro, for the record, with the Alzheimer's Association, here in support of this legislation. I'm sorry Senator Benson herself isn't able to make it and is voting, because I know if she was here, she would bang her hand on this table and talk about the need to support the little people. This is a bill about the little people that we don't often talk about, that don't often come to this hearing. Folks who might not have a college education, folks who need the help. When it comes to Alzheimer's and dementia, as folks may have heard me say, there are over 110,000 Marylanders with Alzheimer's and dementia. These are people who over time have trouble in social settings, over time have trouble getting dressed, over time have difficulty communicating and eating. Direct care workers that this legislation supports are essential. And as Mr. Rodwin has said, we're falling behind in supporting them. I urge a favorable report on this bill to help Maryland regain a sense of competitiveness. It is a necessary expenditure of state funds as we are thinking about priorities and budget priorities with limited resources. Seniors, people with disabilities, others this workforce serves, it's invaluable, essential. We need to recognize them for the healthcare heroes they are. I urge a favorable report.
Good afternoon, Chair, members of the committee. My name is Vivian Boone. I live in Baltimore City, and I have been a home care worker for 35 years. This work is deeply personal and intimate. We get to know our clients up close and personal, and they become like family. When the pandemic hit us, everyone saw how broken our healthcare system was, but it was home care workers who had to keep working through the brokenness. Home care workers, GNAs, CNAs, were pulled to the face of the battle. Many took their loved ones out of nursing homes during this time to care for them at home. We came to your home and assist with daily activities, meals, medication, and provided support during the challenging time. Our clients all have the right to be treated with dignity and respect. And at that point in our lives, we all will need some sort of care through hospitals, rehabilitation, or long-term care. In that time, what will we do? You would wish for a reliable and support care workforce. I have coworkers who are leaving the work field to work at places like Amazon, Walmart, where they get paid more. There's nothing to insensitize people to stay in this field. I love the work I do, but without the increase in pay, I feel like my job, my worth has no value in this society. It's 2.5 years after the pandemic started, and home health care workers are completely left behind. We have a new governor in office that says no one left behind. So I ask you, Chair and member of this committee, to vote favorably for this important bill, SB 604, that raises wages for home care workers. Thank you.
Good afternoon, Chair Griffith and members of the Senate Finance Committee. I'm Tammy Bresnahan. I'm the Director of Advocacy for AARP Maryland. We are a proud member of the Carrying Across Maryland Coalition supporting package of bills. You've seen us come in this session. And I'm here on behalf of our 900,000 members and would like to thank you for allowing us just to say a few words. I can't say and be more passionate than the other speakers because they've said it all, and that is exactly how we feel. But just one sentence, ARP believes that living wages and salaries should be commensurate with comparable salaries in the state and with the time, skill, and effort required to render high-quality services and supports. And this is how we feel. We thank Senator Benson for putting forward this very important bill, Senate Bill 604, and we ask the committee for a favorable report. Thank you.
Thank you. Good afternoon, Madam Chair, members of the committee. I feel that many of you know my testimony by heart, so please feel free to sing along. My name is Bridge Dumais. I'm the political coordinator with 1199 SEIU, United Healthcare Workers East. We are the largest healthcare workers union in the nation and co-founded the Caring Across Maryland Coalition to invest in our healthcare workforce. We urge a favorable report on SB 604 to raise wages for home care workers. As you hear me say all of the time, there is a dire short staffing crisis in healthcare, and this is particularly severe in home care. In Maryland, we will need 40% more home care workers over the next 10 years. Meanwhile, nearly 1 in 10 home care workers live in poverty. You're going to hear powerful testimony from workers today, so I'm going to take a moment to uplift a patient story. Dr. D. Dorian Coulter is a patient and a member of Caring Across Maryland. As a soldier in Vietnam, Dr. Coulter was exposed to Agent Orange, a deadly chemical used by the US government. As a result, he developed congestive heart failure and COPD and is 100% disabled. Dr. Coulter suffers from neuropathy and needs help bathing, eating, and walking, so he gets assistance from home health aides. Dr. Coulter joined Caring Across Maryland because his biggest challenge is not having consistent home health support. He said, quote, "In 4 days, I can have 3 different aides. It's frustrating because by the time they're trained, the next day there's someone new and we have to start all over again. I have had home care aides who have cared for me with such dignity and love, but due to low pay, they often leave the field entirely to make ends meet for their own families. It's unfortunate," end quote. Passing this bill is essential because when workers don't earn enough to live, turnover worsens and patient care suffers. In addition to raising wages, this bill requires annual cost reports from publicly funded home care agencies to ensure compliance. Care workers and patients deserve better, so we urge a favorable report on SB 604. Thank you.
Hello, everyone. My name is Tanya. I've been a care worker for over 12 years here in Maryland. I support SB 604 because it provides the needed investment in home care workers that can improve retention and recruitment to meet the needs of all residents in need of home health care services. Let me tell you about one of my clients, my client Linda. I became Linda's everything. I advocated for Linda. I went to the doctors with Linda. I fed Linda. I helped her get in and out of bed. And anything Linda needed, I was there for her. Linda became my family. It was even to the point that Linda had no support of her own family, that on holidays and Mother's Days and cookouts and everything, where I went, she went. When people still saw me, they looked for Linda. That's how close me and Linda became. And that's how much Linda depended on me. Linda passed in 2001, and it hurt me so bad that I had to take time off because it was like losing a mom to me. Now the client that I have named Anthony, he's a little different. He's been labeled as difficult. Anthony was in a car accident, a motorcycle accident, and was pronounced dead at the scene, but made it through. Anthony has no use of his limbs. He's bedridden. He's angry, he's upset, he cuss, fuss, and hollers all the time. And he has had so many aides that it doesn't make sense. I work with Anthony, and I truly believe that I am helping Anthony come to a quality of life that's really good for him. I don't want to leave this profession, but the amount of wages that I'm getting paid now, it's ridiculous. I find myself in the market making life decisions. Do I buy food or buy gas? Do I pay rent and car insurance and car payment? Or do I let something slide hoping that I can pick it up on the back end? I may bring home $1,800 a month. That's $1,800 a month. I may bring that home. And it's heartbreaking and it's really hard for me to stay in this profession. I don't want to give it up, but I may have to because I can't afford to keep living like this. So please, please, please support SB 604. Thank you.
Greetings, Chair Leader and members of the committee. My name is Fatima. I live in Baltimore County. I have been a home care aide for 5 years. I'm a single mother of 3 children, and I'm here today. For too long, home care workers have been underpaid and overworked. We have been invisible to the society, to the rest of the society as we travel to the people's home, ensuring they are able to do their daily tasks safely and with support. I believe that care workers are a backbone of this economy, allowing loved ones to return to work and ensure our client age in place. I migrate to Maryland from Gambia for a better life for my kid. I know that caregiving has been undervalued for too long due to racism, sexism, and xenophobia. Many are leaving the field because of poor pay, lack of adequate benefit, and risk working condition. I could not pay my rent for 3 months because of irregular hours and low pay. I'm here today to fight for me and for my family, for home care workers and this in the state of Maryland, but also for my patients who deserve consistent caregiver. The work we do is physically and emotionally challenging, and when I go home, I must make sure I can pay my bill and take care of my own health. Because of my children deserve better, I urge you to issue a favorable report on SB 604 so that home care workers earn a just wage. Thank you.
Has everyone who is a part of this panel, before you all exchange seats again, if I could ask if there are any questions for this group? Okay, thank you all very much for your testimony, and thank you for sharing your stories with us and participating in our hearing. I guess the next group is already coming up, so I'll just let you all introduce yourselves as you get ready to present. Good afternoon.
Good afternoon. This is still about SB 604. Yeah, okay. Hello, my name is Alana and I'm the co-director of the DC, Maryland, Virginia chapter of the National Domestic Workers Alliance. We're also a proud member of Caring Across Maryland, and we're the nation's leading voice for dignity and fairness for domestic workers in this country, including home care workers. And I think, like you've heard today, care work really is the foundation upon which strong economies and societies are built. The work that care workers do is tremendous and essential. And like you just heard from Fatima, has been devalued because of sexism and because of racism, and who has always done this work, which is women of color. You heard from David Rodwin and others how the aging population is growing, and there's this crisis that we need to address. And so we want to say that our voice is here in support of this essential bill, and our members of the National Domestic Workers Alliance who do home care will tell us again and again that they love the work that they do. They absolutely love it. They feel like their care transforms the lives of the patients. Like you heard Tanya talk about that. Our members will tell us the same thing, but many of them say, I can't afford to stay in this job. I just can't, because I'm not able to put my son through college. I'm not able to afford my rent. And so we're here really urging the state of Maryland to value this work finally, by passing favorably SB 604. And just want to say the National Domestic Workers Alliance is fully in support of this bill. We want to make sure that this primarily women of color workforce is not faced with continuing low pay, low job quality, and making sure that government funded, Medicaid funded work is finally high quality work. Thank you.
Good afternoon, Chair Griffith, Vice Chair Klausmeyer, and members of the committee. My name is Ioana Stoica, and I'm a policy advocate with the Job Opportunities Task Force, a nonprofit organization that advocates for low-income workers and that is also a member of the Caring Across Maryland Coalition. I'm here testifying on this important bill that will improve job quality for thousands of workers who have been woefully underpaid for the laborious work they perform. Home health care aides are some of the lowest paid and yet most extremely demanding positions. The median annual wage for personal care aides was just over $29,000 last year. At this wage in Maryland, someone would have to work 78 hours a week in order to be able to afford a one-bedroom apartment at fair market rent. This is how we treat workers who are tasked with the most sensitive jobs to care for our loved ones and some of the most vulnerable members of our community, including seniors and individuals with disabilities. And this is how we treat workers in a profession who are predominantly women and women of color. In Maryland, as you've heard, it is an estimated 90% of healthcare workers who are women and 60% of them who are Black. Raising wages would ensure this work is appropriately valued and also would play a role in lessening the gender and racial wealth gaps. Systemically, we need reforms set forth in this bill to address recruitment and retention in one of the fastest growing fields in our current economy and one of the highest turnover rates. Employment in this field is projected to grow 25% over the next 10 years, which is much faster than the average of 6%. Meanwhile, the turnover rate in the profession is 65%, according to recent polling. If we don't address the problem, we are going to reinforce the creation of a two-tiered system of care in which individuals with means are able to afford it, while the rest of us are left to fend for ourselves. Treating healthcare workers with the respect of wages commensurate with the job they perform translates into treating ourselves and our loved ones to the care that we deserve. So we strongly urge a favorable report. Thank you so much.
Thank you very much. I see no questions for you, so thank you so much for your testimony. We do have additional witnesses signed up on this bill. Is Dana Kaufman here? Okay, and she signed up in opposition to the bill. Good afternoon.
Good afternoon. Good afternoon, Madam Chair, Madam Vice Chair, members of the committee. My name is Dana Kaufman. I'm here on behalf of the Maryland National Capital Home Care Association. We are opposed to the bill, but I agree with all of the statements that were made by the previous panelists. Home care workers do deserve higher wages. Their work is extremely difficult, and we do have a crisis. The unfortunate reality, though, is we also have a Medicaid program that does not pay for the cost of the care. When we took a look at this bill and we had several conversations with the advocates this interim, we had stated that the bill that was in last year did it by percentages, and that we would need about a 15% increase, which comes to a little bit over $26 an hour in order to make the $16 and keep the residential service agencies whole. Unfortunately, when the bill came in, it was $25. If we're going to address our nursing crisis, if we're going to address ensuring that there are wages that individuals can be able to live on, the Medicaid program has got to figure it out, and they need a plan. Over the years, we've had a number of reports that have come through this committee. Looking at in 2018, there was a report specifically on looking at the cost of care and the shortages. The next year, there was a 5-year plan required under the budget for how to close that gap. That 5-year plan was never done by the health department. We need to have, similar to what we do for education, the blueprint, we need that for Medicaid, because it's not just residential service agencies and home care workers. It's in all of the industries, the home and community-based services for assisted living, the nursing homes, all Medicaid workers or those workers who work in agencies for Medicaid need to be lifted up in their wages. So thank you.
Thank you. I don't see any questions from the committee. Thank you very much for your testimony. We have one virtual witness signed up on this bill. Is it Ali Andreessen? Good afternoon.
Good afternoon. Thank you. And thank you for the opportunity to testify in support of Senate Bill 604. My name is Allie Andreessen, and I am the Long-Term Care Assistance Project Staff Attorney at Maryland Legal Aid and co-chair of the Aging in Law Task Force. Maryland Legal Aid is a nonprofit statewide law firm providing civil legal services to Maryland's low-income residents. Our low-income clients include people currently in the workforce and those out of the workforce living on fixed incomes, receiving home and community-based services, HCBS for short, through the Medicaid programs included in this bill. And Legal Aid supports this bill because it's one where there's benefit to everyone, no matter which way the coin flips. Personal care aides benefit, and Maryland's older adult population and people with disabilities benefit. Personal care aides, as we've heard today, have a mentally and physically demanding job. They provide very private personal services to the individuals they care for, including assistance with toileting, bathing, feeding, managing medications. They spend their days caring for other people's parents and loved ones, and they make very, very low wages. Over recent years, many personal care aides have left the industry and found higher paying work at restaurants, retail establishments, and places like Amazon. This bill would institute a minimum wage, a more livable wage, for the personal care aides providing these life-sustaining services. And secondly, this bill benefits current and future HCBS program participants because more workers and better workers will be attracted to the field. And as we've heard today, this is currently a very real problem. I've worked with multiple clients who were found eligible to participate. They had completed the arduous approval process only to be told that they were on a wait list to access an aid. And with Maryland's growing older adult population, it is imperative that there is more personal care aid workers so that more people can access these services, avoiding being institutionalized in a nursing home and the harm that comes from that. HCBS programs are vital to allowing our older adults to age safely and with dignity in their own homes. And for the reasons stated above, Maryland Legal Aid supports Senate Bill 604, and we urge a favorable report. Thank you.
Thank you. There are no questions from the committee, so we thank you very much for your testimony, and that will conclude the hearing on Senate Bill 604. Colleagues will now turn to Senate Bill 801, which is Economic Development, Cybersecurity, Cyber Maryland Program, and Senator Hester. And if you have a panel, Senator, you can feel free to bring them up.
Thank you, Madam Chair.
Absolutely.
Madam Chair, I also had a few slides. Does committee staff have those?
Yep.
Well, I think we need this. I think you're second. Thank you, Madam Chair, and apologies. If colleagues want to follow along with the graphics, my testimony does include the PowerPoint slides, so you can pull it up on your computer. But I guess I'll just give it a go without the slides. For the record, Senator Katie Fry Hester, pleased to represent District 9, Howard and Montgomery counties, here for your consideration of Senate Bill 801, which creates the Cyber Maryland program aimed at addressing the workforce shortage in cybersecurity. So I did have a few short slides, but I'm going to just walk through what I would have said anyways. Many of you will have, well, actually, who's new? Senator, there's a few of you who have heard this last year. I had a workforce, yes, you've heard it. Fabulous. You're new. Okay, so for those of you who are new, you probably know anyways that we have an ecosystem of cybersecurity organizations across the state. And these include places like Fort Meade, the National Security Agency, U.S. Cyber Command, and many DoD contractors that support the federal government. And this amazing ecosystem means that we have approximately 20,000 cybersecurity jobs open, and that number continues to grow. And that will be compounded further by the fact that there's a new federal requirement, the cyber maturity model certification, that will need an additional 6,000 extra practitioners. And so in the graphics, you would have seen that our current workforce is about 46,000 people strong. And then we have these 20 to 26,000 open jobs. So we could literally increase our workforce by 50% if we could get people sitting in these jobs. So how do we do that? How do we fill these open jobs? One we're already doing quite a lot as a state. We have scholarships, we have apprenticeships, we have the P-TECH program, we have a career track that's coming forth in the blueprint. But what I can tell you from studying this with the Maryland Cybersecurity Council is that what we lack is a North Star, something to pull all of our disparate cybersecurity workforce talent programs together so that we can double down on those that are working and tweak those that can potentially be improved. We looked at several models over the interim. We looked at Georgia Cyber, which is a very powerful combination of collaboration between the state, the military, academia, and the private sector to grow their workforce. We looked at Florida Cyber, which does very similar things. And so that brings us to the need for Cyber Maryland, which will have very similar goals. It will fast track economic mobility with an equity lens to get people into these high paying jobs. It will cultivate the most advanced and diverse talent pipeline in the nation and so much more. So what exactly does Senate Bill 801 do? It creates the program within TEDCO to analyze real-time industry data and develop a dynamic talent roadmap so that we know in these quickly changing jobs what industry needs and how to fill those jobs. It creates an advisory board for this program with members from state agencies, universities, the private sector, and nonprofit with guidance to oversee the program. It also establishes the Cyber Maryland Fund, which will supplement our existing talent investment, filling the gaps once they're identified. And finally, it will produce real results, putting people in those available jobs, accelerating the cybersecurity talent, improving Maryland's cybersecurity posture, and growing our economy. Now, a key part of this, which you will notice on the slide when you take a look at it, is that we're taking this data-driven approach. We're actively working with industry in the talent pipeline management process, which you'll hear about shortly from the panel. But the thing I really want to leave you with, colleagues, is that a career in cybersecurity can truly change lives. You'll hear from Baltimore Cyber today about how many of their trainees have gone from being underemployed or unemployed to making $90,000 to $160,000 a year. And the growth in this industry means that there's significant opportunity for advancement and then future stability in the field. So colleagues, in closing, Maryland Cyber is a true win. It will fast track economic mobility through an equitable and inclusive process. It will help us to cultivate the most advanced and diverse state and local IT workforce in the nation. It will fill these 20,000 open jobs in the next 3 years. And ultimately, it will secure Maryland's leadership position in the world of cyber. For these reasons, I request a favorable report on Senate Bill 801, and I open it for questions and turn it to my panel. Madam Chair, at your preference. Okay. Let's see, who wants to go first? You guys want to go first? Okay.
Madam Chair, members of Senate Finance Committee, for the record, John Fiastro on behalf of CAMI. I'll be introducing Executive Director of CAMI, Ms. Tasha Cornish, to add her comments. But I do want to mention that this committee has voted on this bill in a previous incarnation last year, Senate Bill 753. It did get to the House. The House did pass that bill, but on sine die with little time to get it reported back to the Senate. So we're coming back again with this slimmed down version with the same objectives, but I think it answers some of the questions from last year. So we're very happy that Senator Hester has brought it back. We want to thank her for her leadership on this issue. And this is really a complement bill to the package of cybersecurity bills that the legislature passed last session. So we thank you, the Senator, for her sponsorship. I'd like to pass it on to Tasha Cornish from CAMI. Thank you.
Thank you, John. Again, Chair Griffith, Vice Chair Klossmeyer, thank you, and the entire committee, thank you so much for taking time to hear our testimony today. I'll be brief. I also submitted most of this in writing, but I really want to focus, we're here today representing our over 600 corporate members, and that ranges from small government contracting companies to multinationals like Motorola Solutions and Cisco, who are our members. And everybody needs to grow their workforce here in Maryland. They're committed to growing it here. As Senator Hester mentioned, we are up to 26,000 jobs on any given day in Maryland. That's already increased by 4,000 in the last year. And this is going to continue to increase. This is a real economic driver for the state. It will really continue to support companies when they're looking to invest in this region if we have this strong, highly trained workforce. these are high paying jobs, right? And we have a lot of assets, as mentioned, and we really just need this to help be our North Star. John mentioned, it's a lot lower investment this year. So we're happy to be here to support it. Thank you for hearing us and hearing the rest of the panel.
Good afternoon, Madam Chair, Madam Vice Chair, and members of the Senate Finance Committee. My name is Bruce Spector. I'm the chairman of Baltimore Cyber. I'm also a member of the board of directors for CAMI as well. I'd like to start by commending Senator Hester for sponsoring SB 801 on behalf of CAMI and the cybersecurity industry. We sincerely appreciate her dedication and foresight in recognizing this very important issue. As Senator Hester said earlier, Baltimore Cyber is a grantee of another Maryland workforce development program called EARN, which I'm sure most of you are familiar with. And it's a demonstration of how effective state government can be in workforce development. We've been doing this for 5 years. We've trained 1,000 people. Of those 1,000 people, they were all unemployed or at least underemployed. Over 900 are currently employed with an average salary over $90,000 a year. This is without a college degree. This is as incident responders in cybersecurity. If you look at the diversity profile of these students, we're looking at maybe 68% people of color, 50% are women, which is also kind of a sad statement regarding the unemployment lines, because that's basically what we're drawing from is people that are unemployed. So that said, we wholeheartedly support Senate Bill 801 because it would allow us to, rather than work as a pilot, perhaps be able to get mainstream. Instead of addressing 1,000 over 5 years, maybe we can do 26,000 over the next couple of years. So we wholeheartedly ask the committee to support this project, this bill, and we're happy to answer any questions. Thank you.
Madam Chair, always good seeing you, members of the committee. My name is Troy Lamel Stovall. I serve as the CEO of TEDCO. I want to again thank Senator Hester for her continued leadership in this very important matter. As many of you have heard us say at TEDCO, there are 4 S's that we believe we need to really think about for the state. That's about how do we scale differently? How do we stitch together things that we've not stitched together before? How do we storytell better? But the S I want to focus on today is stickiness. And stickiness really is an important part of this conversation, because a lot of the firms that we lose that we've invested in at TEDCO leave the state, not for the reason you think, it's because of the lack of talent, particularly around cyber. And that cyber talent isn't just always that. When you hear the word cyber, too many of us think about cyber as something involving the NSA. I would tell you every company in every county in this state needs somebody that has cyber talent. I don't care if you're a bakery or a dry cleaner, you need somebody with cyber talent. And that's what this bill tries to give us. But from where I sit as the CEO of TEDCO, we also need to think about an innovation infrastructure and how do we really compete differently. And this bill gives us the tools that we need to do that. So we stand ready in support of this bill and can answer any questions you may have. Thank you.
Thank you all very much for your testimony. I don't see any questions for the sponsor or the sponsor panel. So thank you very much. We do have additional witnesses signed up on the bill. So thank you all for your participation. We're going to call forward Laura Nelson, Brad Phillips, Dan Wolf. Good afternoon. You can get started as soon as you're ready.
Okay, thank you. Thank you, Madam Chair, Vice Chair, and the members of the Senate Finance Committee for giving me the opportunity to speak with you today. My name is Laura Nelson. I'm the President and Chief Executive Officer of the National Cryptologic Foundation. I am here today to support Senate Bill 801 for the Cyber Maryland program. Today, according to cyberseek.org, there are over 750,000 jobs nationwide unfilled in cybersecurity. And as you've also heard, 26,000 in the state of Maryland alone. Prior to joining the foundation, I was a senior executive for the National Security Agency, primarily leading technical organizations that required a highly skilled workforce. I know firsthand the difficulty in hiring and retaining people with the necessary education and skills to work in the cybersecurity and cyber-related fields. Just last week, the National Cyber Strategy was released. One of the key pillars of the strategy is to invest in a resilient future that includes developing a diverse and robust national cyber workforce. A quote from the strategy: Building and maintaining a strong cyber workforce cannot be achieved unless a cybersecurity career is within reach for any capable American who wishes to pursue it, and every organization with an unfilled position plays a part in training the next generation of cybersecurity talent. We have seen the success of in other states who have implemented programs similar to what was proposed in this bill. Senator Hester referred to the Georgia Cyber Center, which focused on creating an ecosystem for government, academia, and industry to deliver affordable and relevant cybersecurity training and education. Likewise, Cyber Florida was established, positioned Florida as a national cyber leader in cybersecurity through education, research, and outreach. Establishing a Cyber Maryland program will position our state to increase our cybersecurity workforce and create a talent pipeline and serve as a one-stop shop for Maryland employers seeking to leverage cyber workforce development, education, and training programs. My foundation is focused on youth and getting youth into these fields. And this will be, getting people who are coming fresh into the workforce right out of high school. So please do support this bill. Thank you.
Good afternoon, Chair, Vice Chair, members of the Finance Committee. My name is Brad Phillips, and I'm here on behalf of the Maryland Association of Community Colleges for support of this legislation on behalf of all 16 members. I think the takeaway here, you've already heard cyber is a part of every part of the Maryland economy. What I want to get across is it doesn't require a 4-year degree in order to work in this field. In fact, often not, more people that have 4-year degrees have to come back to community colleges to get the certification that they need in order to prosper in this environment, cybersecurity environment. It was around 2016 that we had a labor grant when Tom Perez was Secretary of Labor that created a cyber technology pathway across Maryland. And 14 of our 16 community colleges participated in that. And from that, we've actually branched out and built out strong cyber programs. And you just heard from Cyber Baltimore, one of those programs we partner with through an earned dollar, and it produces 550 workers in this field, and it is ready to be ramped up and do more across the state of Maryland. We provide a diverse workforce to fill these jobs. We have minoritized populations. We have women that are in this population that can advantage and become part of this male-dominated workforce. So we just really encourage you to pass this legislation again this year and see it across the finish line. Thank you very much.
Good afternoon. Good afternoon, Chair Griffith, Vice Chair Klausmeier, and members of the committee. My name is Dan Wolf, and I'm the Director of State Programs for the Alliance for Digital Innovation. We're a nonpartisan alliance of technology companies focused on accelerating change in the public sector through technology. Our members are some of the most innovative technology firms in the nation, including many that already proudly serve the state of Maryland. We support Senate Bill 801 and urge you to return a favorable report. Around the country, we hear endless stories about businesses and government agencies impacted by cyber attacks. Globally, cyber attacks have more than doubled since early 2020. Particularly in the public sector, governments are attractive targets for cyber criminals. This is because of a combination of outdated technology and limited resources that leaves them vulnerable to attacks. It's particularly true for local governments who have small staffs and struggle to hire cyber professionals. I personally experienced this as the former deputy CIO of the Commonwealth of Virginia, who's in charge of hiring cyber professionals. It was difficult to recruit and retain talent, even in a talent-rich environment like the Commonwealth was. Nationally, there are more than 500,000 additional skilled cyber professionals that are needed. And the current estimates by the federal government state that this number is going to grow by 30%. That means that more than 1 million additional cyber workers are needed in this country by the end of the decade. This is a daunting task. Action must be taken immediately to create a long-term solution to this looming crisis. Leaders must implement programs that will reskill their current workforce while developing the next generation of skilled cyber professionals. SB 801 would help to address this looming cyber workforce gap in the state of Maryland. The Cyber Maryland program represents a foundational element in a statewide cyber workforce development program that can meet both short and long-term needs by promoting statewide education and improving collaboration across the state. It has the opportunity to break down silos between state government, local government, higher ed, and K through 12 by bringing together diverse stakeholders from the public and private sectors to address a shared goal, a cyber talent pipeline that will benefit Maryland and beyond. Thank you for your time.
Thank you for your testimony. There are no questions from the committee, so we thank you for your participation in the hearing. And colleagues, that will conclude the hearing on Senate Bill 801. We're going a little out of order today due to presentations by some of our colleagues in other committees. So we're now going to turn to Senate Bill 581, which is Behavioral Health Coordination Value-Based Purchasing Pilot Program. Senator Klausmeyer, Vice Chair, presenting the bill. You can bring your panel up if you have. Madam Vice Chair, if you can bring your panel up. Senator Mounts is through chatting. We'll
Yes,
get-
Senator Mounts. Senator Mounts is second on this bill. Maybe I should just let him do it, right? Lori Doyle.
I'm Shannon Hall for CBH.
Okay. Tricia Swanson.
Here.
Shannon Hall.
That's good.
Oh, you're Shannon Hall.
I'm
And Dan Reck.
He's in the hall, Senator. Grab.
Guess he's not paying attention. I'm going to start. You get him in. Senate Bill 581, Behavioral Health Care Coordination Value-Based Purchasing Pilot Program. Senate Bill 581 will establish a behavioral health care coordination value purchasing pilot program in the Maryland Department of Health. Value-based purchasing simply means financially incentivizing providers to meet selected outcome measures. Value-based purchasing offers different from purchasing differs from fee for service in a very different ways. Fee for service rewards volume, so the more services you provide, the better off you are financially. Value-based payments reward results. There is no incentive to provide unnecessary services. Fee for service does not distinguish between good and poor quality providers because value-based purchasing rewards result only those providers who can achieve the desired outcomes will receive incentives. Fee for service is inflexible and prescriptive, while value-based purchasing allows the flexibility needed to meet individuals' needs and population health goals. The somatic healthcare system migrated towards value-based payment VBP many years ago. VBP arrangements currently exist in Medicare and are also seen here in Maryland as a total cost of care model. We know from Maryland hospital data that the behavioral health care is overrepresented in emergency department utilization and contributes to the emergency department throughout challenges. Senate Bill 851 would help address these problems by incentivizing providers to meet goals such as reduced ED and inpatient utilization and lowering total health care expenditures. Senate Bill 581 will establish, this is the most important part, is a 3-year pilot program involving at least 500 adults whose behavioral health conditions or functioning places them at risk of ED utilization or inpatient psychiatric hospitalization. Chosen providers would be paid a per member per month fee to provide intensive care coordination for these individuals. Following the initial startup year, providers will receive their full care management allotment only if they have achieved the goals targeted by the state. The allotment withheld will increase in year 3. The bill will also require MDH to report the findings and recommendations from the pilot program to the governor and General Assembly by November 2027. It is time for our behavioral health system to be focused on results rather than volume. I urge a favorable report for Senate Bill 581. And I might add that when we had this is one of the specific bills that is in our package of behavioral health bills. So thank you very much. We lost it.
All right. Thank you very much, Spencer.
My name is Shannon Hall. I'm the Executive Director of the Community Behavioral Health Association of Maryland. We represent addiction and mental health providers across the state of Maryland, and we urge your support for this bill in front of you today. Many of our 110 members have invested their resources in measuring outcomes and working to innovate and improve the results of their work. We've got 18 providers who are measuring outcomes and moving the needle on care for over 25,000 patients in Medicaid today. Since CBH has launched this project with our members, we've improved providers' ability to respond and address suicidality. We're improving therapeutic alliance, and our members are making investments in truly innovative care. We are one of the few sectors in Medicaid that has not had the opportunity to participate in a value-based purchasing program that rewards value instead of volume. This bill in front of you today would help move Medicaid in that direction with a small pilot program working with behavioral health providers. So we urge your support, and I'm here to address any questions you may have. Thank you.
Madam Chair, members of the committee, my name is Tricia Swanson. I'm the Acting Director of Government Affairs for Care First Blue Cross Blue Shield, here in support of Senate Bill 581. As some of you may remember, Care First is a strong supporter of value-based care arrangements as a vehicle to incentivize providers to provide a high-quality care in an efficient manner. Last session, this committee sponsored and pushed through a value-based care bill that passed that's currently moving Maryland in a direction to promote increased quality and better health outcomes through value-based care arrangements with providers. This bill is one more component to help support the goals of VBC, and this pilot program will drive better health outcomes and improve the patient experience as a part of a welcome step towards broader delivery system transformation to better serve those with behavioral health needs. So with that, we would urge a favorable report. Thank you.
I'm so sorry. Good afternoon, Madam Chair and committee members. My name is Dan Reck. I'm the CEO of Mac Clinics, testifying in support of SB 581. Mac Clinics was established in 2016 to provide high quality outpatient addiction treatment. We have 8 locations across Maryland and treat more than 4,000 patients annually for substance use disorders. 3 out of 4 of our patients are Maryland Medicaid beneficiaries. I spent most of my career in financial markets until a family member's experience gave me a front row perspective on the need to improve the quality of care and addiction treatment. My co-founders and I launched Mac Clinics with the goal of doing just that by applying our experience in successfully managing large, sophisticated businesses. At the expense of profitability, we've funded the development of systems that demonstrably improve outcomes for our patients. One of these systems is the use of data analytics to help patients achieve recovery more efficiently, an approach we developed with scientists at the National Institute of Drug Abuse. In its simplest form, we calculate scores which represent adherence to treatment. Low-scoring patients are allocated additional resources, such as intensive outpatient counseling, mental health therapy, and psychiatry. At the same time, high-scoring patients are able to engage in maintenance treatment only. Unfortunately, in a fee-for-service environment, there is no mechanism to encourage providers to compete on the quality of patient outcomes. As a result, the state is missing an opportunity to broadly incentivize higher quality care and addiction treatment. I strongly advocate for the passage of SB 581 to allow Medicaid to pilot a program in which quantifiable performance standards are used to reimburse providers. Mac Clinics is demonstrating that data can be used on a patient-by-patient, visit-by-visit basis to improve health outcomes. Thank you for the opportunity to share my perspective with you today.
Thank you. Are there any questions for the sponsor, the extra sponsor, or the panel? Okay, I don't see any questions for you. Thank you very much for your testimony. We do have 2 additional witnesses signed up on this bill, Lori Doyle and Josh Howe.
No, Lori.
No, Lori, Josh Howe?
I think you took Lori. Lori's in another
Okay.
hearing, and so.
Okay. Don't see.
Thank you.
Okay, it looks like that concludes the hearing on Senate Bill 581. We'll now turn to Senate Bill 582. Senator Augustine, behavioral health care treatment and access, behavioral health model for Maryland. Hello again.
Yes. Thank you, Madam Chair. I'm pleased to be back again, this time with Senate Bill 582, Behavioral Health Care Treatment and Access, Behavioral Health Model for Maryland. Colleagues, I don't need to really overly reiterate the behavioral health crisis that we find ourselves in. The number of kids that we have suffering from depression, 57,000, significant numbers, over 40% of them as a group experiencing depression. 781,000 adult Marylanders with mental health, conditions, and just the inadequate access to care that we find, financial concerns that are associated with behavioral health. This is obviously something that we know is a very serious matter, and one that really does require a comprehensive look at how we are going to contend with this, and also pretty specific tools to deal with the matter as well. And that's what this bill does. This bill lays out a commission to broadly look at and develop recommendations. And then it has very specific pieces of tools and programs that can address the immediate needs and concerns that we have. So what the bill does is it establishes a commission on behavioral health care treatment that really does seek to pinpoint the needs and gaps in service through our state specific needs and the assessment of it, to analyze the methods for reimbursing behavioral health care services, ensuring a sufficient workforce, analyzing adequate policies and reimbursement strategies, learning from other states too, because we want to build this world-class system for us here in our behavioral health space. And then we, of course, within that, there are also just some pretty specific areas that we know we have concerns with, be it geriatric and youth populations, and those who have complex behavioral health needs. We want to make sure that we really evaluate that health structure, the infrastructure, facilities, personnel, services, access for Maryland, and the forensic population, and to really take a real good hard look at our deficiencies, because we know that we have deficiencies, and prioritize health outcomes to advance public safety and reduce as well, because this always, I've talked about this for quite some time, reducing recidivism as well. And so we also know we need to look at Maryland's court-ordered population, where we do see a significant amount of mental health, mental illness, substance use and substance abuse, people receiving some level of treatment there. And so we know that this bill is set to do just that, to create that commission, to be able to address those issues. And it has also within it, in keeping with what I just talked about, work groups to really look specifically at that. The composition of it, we worked hard in the interim. This really was done in partnership with the folks in the House, and in partnership with Chair Pena-Melnick, really worked together in the interim to come up with what we thought was a good group of people to really be the leads as a part of the commission. We also then looked at, and I just won't go over them again, but they are, because I said we have in this bill both the commission and also specific tools. You just heard from Senator Klausmeier on Senate Bill 581, which is also encompassed in this bill because it is a comprehensive bill. You also have already heard in here Senate Bill 362, which establishes certified community behavioral health clinics. That is also incorporated into this comprehensive bill. And you have also heard Senate Bill 534 from Senator Guile on the telehealth sunset extension bill, which of course is already passed out of this committee. That same very, very important, although simple, but extremely important language and bill is within this bill. And so, good colleagues, when you bring this all together, I think that this is an extremely important bill. It's a part of the package that we put together as a Senate as being something that we really see as a priority. And I will ask for a favorable report on Senate Bill 582.
Go ahead. Thank you, Senator Augustine. I'm Shannon Hall, again, Executive Director of the Community Behavioral Health Association of Maryland, representing mental health and addiction treatment providers. We're very grateful to Senator Augustine for his leadership and so much of your support. The commission helps Maryland move forward in a planful, thoughtful way on how to develop and ensure that we have the best available mental health and addiction treatment services for Maryland. And the three components that Senator Augustine just reviewed help us ensure that we are taking steps forward to lay the groundwork and preserve what needs to be preserved to help us maximize and address the crisis we are in right now. So we urge your support for this, and I'm here to answer any questions you may have. Thank you.
All right, Madam Chair, members of the committee, Dan Martin with the Mental Health Association of Maryland, here in support of Senate Bill 582. Thanks, Senator Augustine, for introducing it. Every piece of this bill is important. Expansion of CCBHCs will help ensure that we're addressing Marylanders' behavioral health needs early, preventing crises, saving money, and saving lives. Value-based purchasing, as you just heard from Senator Klausmeyer's bill, ensures we're focusing on patient-centered care and reimbursing for outcomes, not volume of services. And the extension of telehealth provisions ensures we're able to provide people with care when they need it, where they need it, and how they need it. And you've heard all of these already has been discussed in standalone Senate bills. And so urge your passage of all these pieces, whether in this bill or via those bills, some way. The new thing about this is the Behavioral Health Commission that you haven't heard about before, which we are also very strongly in support of. Behavioral health stakeholders have worked long and hard, to get to this point where we're where after many years, we're finally starting to see progress and a lot of attention to the behavioral health needs of Marylanders. And we're making a lot of progress this session, and again, in the bills that we've been talking about in the Senate leadership package. And as reforms in these areas progress, this commission can play a really, really important role in ensuring that these efforts are integrated, coordinated, and properly resourced. And so as such, we're excited for this commission to kind of get to work right away, so that we can kind of start building a plan, so that we can start developing a plan that coordinates these ongoing efforts that, like Shannon said, are laying the groundwork, and then kind of, make sure that we're using the remaining 3 years of that, the commission to kind of just ensure successful execution and oversight of the plan and make sure that we're allocating resources appropriately. And so for those reasons, support Senate Bill 582 and urge passage. Thank you.
Good afternoon. My name is Shelley and I support Bill 582. The mental health care system in the state has failed my teenage daughter. The isolation caused by COVID pandemic has impacted our youth and, as recognized recently by the CDC report, particularly affected teenage girls. My daughter, living with her father, was in 8th grade when the pandemic hit and stayed isolated at home without going to school for the next 4 years. Her father rarely was at home at all and did not connect her with any telemedicine. She was able to see a healthcare professional and she was signed off on a quote home hospital program, not an outpatient clinic, and not any teletherapy as a first step. As a result, her schoolwork deteriorated and her isolation only harmed her further. Last year, she was dumped off at a level 4 inpatient psychiatric facility after just 20 minutes in a telemedicine meeting with an inpatient personnel from that facility without any referrer from the outside. My daughter was admitted to the eating disorders wing. My daughter does not have an eating disorder. During her 3 weeks there, it was obvious to me inpatient facility was not helping her and was causing her more pain and suffering. My daughter demanded to be released. Those demands were ignored, despite the law requiring her to be released or involuntarily committed within 72 hours. It was not until lawyers from the state of Maryland intervened on her behalf that she was allowed to go home. My 16-year-old daughter's ordeal has not ended. This time, a nurse psychiatrist who was not providing any actual care for her other than evaluating medicines, signed a document and stated, well, she's not going to school anyway. However, the school rejected her this time for the home hospital, and she is at risk of dropping out of school permanently. Thank you.
Thank you very much for sharing your experience with the committee. I don't see any questions for the sponsor of this panel, so we thank you very much for your testimony. And we will call, I guess Lori Doyle still isn't here, but I have to call. Okay, there she is there. See, they were saying no. That's why I called. Okay, we've got Daniel Reck, Josh Howe, Allison Taylor, Morgan Mills, Melissa Rosenberg, Tricia Swanson. Oh, I may have called more people than chairs. Okay. Okay, well, very good. Good afternoon. You can go ahead and start when you're ready.
Good afternoon, Madam Chair. Lori Doyle here on behalf of the Community Behavioral Health Association in Maryland. And I appreciate you letting me come up. I was on the other side of the street. And I'm not going to belabor it. I think you've heard about value-based payment. That's a standalone bill, but also incorporated in the larger Behavioral Health Model Act. Just to say, I was listening to the tail end of the testimony that you just heard. And that's exactly what we're trying to get at. We're trying to get at the fact that we shouldn't be paid just for volume. We should be paid for results. And we know we can do that. Everything in healthcare is moving to value-based payment. We're tired of incentivizing volume. And so it's time for behavioral health to catch up and move into this century. And we think that this bill, whether it's the standalone or part of Senator Augustine's bill, is the way to do that. Thank you.
Yeah, you just heard me all before, so I won't repeat myself, but I really do appreciate the opportunity to be here. And again, I just would put us out there as an example of a provider who has, we've basically structured ourselves in a way because we hope that value-based care is the future. So we structure ourselves in a way that we can participate by providing better outcomes. And so I just would urge you again to support now Senate Bill 582. Thank you.
Thank you. Good afternoon, Chairwoman Griffith, Vice Chair Klausmeier, and distinguished members of this committee. My name is Morgan Mills with Compass Advocacy here today on behalf of NAMI Maryland. For years, Marylanders have been struggling to get the mental health help they need, and this is why we need to prioritize accessible and comprehensive behavioral health services. Establishing a commission to do this and make recommendations is crucial. This commission would help ensure people with mental health conditions have affordable and comprehensive health care. We support all individual components of this comprehensive plan, as well as the establishment of the council. However, there are other councils such as the state's Behavioral Health Advisory Council that are legislative and regulatory bodies established by the state law. So we would request just a bit of clarity in this bill so the bodies are able to work collaboratively because the establishment of the commission could affect these already existing groups. Additionally, we recognize the significant fiscal note, but is absolutely worth the investment because we know there will be a decrease in the need of emergency department utilization, inpatient hospitalization, and criminal justice system involvement. Wellness is an important investment that will lead to decreased public cost, improved resource allocation, and reduction in stigma, thus improving the lives of all of those affected by mental illness. For these reasons, we urge a favorable report. Thank you.
Thank you. I'm Melissa Rosenberg. I'm the Executive Director of the Howard County Autism Society, and we serve the autism community in Howard and Montgomery counties and the surrounding areas. And thank you to the committee for allowing me to speak today. Overall, we support SB 582. And at the same time today, we're here joining with other organizations across the state that represent individuals with intellectual and developmental disabilities to ask for some amendments to the bill. We respectfully request the following, which would be membership in the commission So an individual with IDD or a family member who have experience as a consumer of behavioral health services, being expressly included in the language of the recommendation. There are 12 required areas. We would like it to spell out intellectual, the IDD community, either to be included and identified in one of the work groups or have an additional work group created. And also to be included in the definition of behavioral health, and also to be considered that we expand the pilot program to include some teenagers. There are many unique needs of the IDD community. We've had so many families who've experienced a teenager or young adult in the ER waiting for services with autism and other IDD for weeks or months. One of the most tragic was one of our families, the Chafos family. I included a copy of the article from the Washington Post with my testimony today. Zachary Chafos' mother was not able to be here, but they spent 72 days total in the ER waiting for inpatient services. Really not being able to go outside, just in the four walls of the emergency room. This is not unusual. And he died once he finally got inpatient care. So please consider our amendments and thank you for your time.
Madam Chair, Madam Vice Chair, members of the committee, my name is Tricia Swanson, Acting Director of Government Relations for Care First, here in support of Senate Bill 582. I won't repeat what the panel said. I'll just add, anecdotally, this is a really exciting time to kind of have come into the state healthcare space in Maryland. This committee has seen dozens of bills over the years to really try and tackle behavioral health issues and public health issues, and the comprehensive approach that you guys are deciding to take this session to ensure that we have a world-class system here in Maryland is really, really exciting. And I applaud all of you for the work that you're doing. We just asked for a minor amendment that I believe to be friendly. We came to the table to support Senator Giles' bill on telehealth, and just ask that we include language for MHCC to study the audio only language. We just ask that depending on the way that the committee is moving the bills, that study be included in this comprehensive bill as well. The testimony or the amendment is in my testimony, and I'm available for any questions. But again, thank you to each of you for the work that you're doing.
Hi, good afternoon, Madam Chair, members of the committee. My name is Allison Taylor. I'm here on behalf of Kaiser Permanente in support of this bill. Two quick things. I accidentally signed up written only on the prior bill about the value-based care program for behavioral health. We're very supportive of that. Kaiser Permanente provides a managed care model for all populations it serves, whether commercial, Medicare Advantage, Medicaid, with the one exception being behavioral health care in Medicaid. Given the structure of the current health choice program. So do see this as an opportunity for us to participate and do completely plan to try to do that. Also very supportive of the telehealth provisions and support the amendment that Ms. Swanson just spoke about. So thank you very much.
Thank you very much. Are there any questions for this panel? Okay, seeing none, thank you very much for your testimony and participating in our process. We have additional witnesses signed up favorable with amendments: Ann Seacott, Tracy Palliath, Ellen Weber, Dan Rabbit, Jake Whitaker. Good afternoon. You can get started as soon as you're settled.
Good afternoon, Madam Chair, members of the committee. I'm Ann Seacott, testifying today on behalf of numerous clients, including the National Council on Alcoholism and Drug Dependence, the Maryland Addiction Directors Council, the Maryland Association for the Treatment of Opioid Dependence, the Maryland DC Society of Addiction Medicine, and On Our Own of Maryland, all in strong support of the bill. And we thank the sponsor for bringing it forward. As you'll see in written testimony from NCADD, and NCADD is grateful to be included in the bill. The other organizations that I mentioned that are associations of treatment providers and peer recovery support providers are also interested in participating, preferably as members of the commission. We know a commission can't be 100 people big. So, I think that there's also, the ability perhaps to amend the bill to allow for additional work groups. Right now, it specifies only 4 work groups could be created. And we think that greater participation and addressing additional issues can happen if there are additional work groups allowed. And then in terms of the purpose of the commission, we would ask for 3 additional pieces to be added. One is to take a really hard look at the need for a community health access program, which some of you will remember from legislation last year. It's really to help people who have insurance be able to access their benefits. We would ask for a look at how hospitals across the board address people who come into emergency rooms with medical emergencies related to substance use disorders. And we also ask that harm reduction be one of the things that the commission looks at. Harm reduction provides access to services for people when the services meet people where they are. And so we ask for these amendments and your support.
Good afternoon, Madam Chair, Madam Vice Chair. My name is Tracy Paliath. I'm here on behalf of the Maryland Developmental Disabilities Coalition. We are 5 statewide organizations that are committed to improving the opportunities and outcomes for Marylanders with intellectual and developmental disabilities. We want to thank Senator Augustine for including a member of the DD Coalition on the commission that's established in the bill. It is vital that any broad look at access to behavioral health services includes the needs of people with intellectual and developmental disabilities. People with developmental disabilities experience co-occurring behavioral health challenges at a higher rate than the general population, yet they experience significantly more barriers to access treatment. Families report that it is extremely difficult to find a mental health professional to treat their loved one. And when an adult has transitioned to community-based DDA services, it can be virtually impossible to find that help. This results not only in people getting the treatment they need, but it results in more pressure on hospitals and ER departments. Very quickly, we would like to request, as Ms. Rosenberg did, a person with IDD who has been a consumer of behavioral health services on the commission, and a family member of someone with developmental disabilities with lived experience of seeking behavioral health services. We would also like to see a work group that focuses on people with developmental disabilities who have a co-occurring mental health issue. I thank you for your testimony and urge your support. Thank you.
Good afternoon, Madam Chair, members of the committee. My name is Dan Rabbit. I'm a policy director at Behavioral Health System Baltimore. We stand in strong support of SB 582. We actually in Baltimore City, which is we're the local behavioral health authority in Baltimore City, we actually oversee a form of a value-based purchasing pilot program called the capitation program that serves 350 of the most seriously mentally ill residents of Baltimore City. We also have 2 CCBHCs in Baltimore City. And we're seeing strong results from all of those initiatives, and we're happy to see that go statewide if this bill passed. We are also in support of the commission, but like many of our partners are submitting an amendment. Our amendment is to add 2 local behavioral health authorities to the commission. It wouldn't necessarily have to be Behavioral Health System Baltimore. It's really not about our own perspective, but just the important really essential role that local behavioral health authorities play in the system of care. They manage the full range of mental health and substance use services in each jurisdiction across the state, rural, suburban, and urban. The majority of the Behavioral Health Administration's funding gets passed through to locals who then do the contracting and grant procurement and licensing and oversight of the local systems of care. Local behavioral authorities are thinking about what are the gaps, what are the reimbursement structures, what are the things we need to be planning for in advance in order to have an effective behavioral health system all the time for their own jurisdictions. And we feel it was an omission that they weren't included in the commission to begin with. So we ask that you consider that amendment. We know there's a lot of other requests, but we think that local behavioral health authorities really are a unique, play a unique role in the system. So thank you for your consideration, and we hope for a favorable report.
Thank you, Madam Chairman and members of the committee. My name is Ellen Weber. I'm with the Legal Action Center. We convene the Maryland Parity Coalition, whose purpose is to expand access to mental health and substance use disorder services. We support the creation of a commission with some proposed amendments, which are attached to our testimony. Those amendments focus primarily on the commission's purpose and the various tasks that they would perform. In addition to the stated purpose of making recommendations on a number of areas, we really believe that the commission should also ensure coordination of the services at the many agencies that serve Marylanders with mental health and substance use disorder conditions. So we would urge you to expand out that purpose. We also propose 3 additional priorities for the commission's recommendations, very much along the lines of Ms. Seacott, what Ms. Seacott had identified. First, the integration of substance use disorder and mental health services in all general medical settings, including emergency departments and skilled nursing facilities, is very important to deliver effective care and expand access. Secondly, we would urge again to examine the full range of harm reduction services. And third, to develop the consumer health access program. And finally, we propose a few different amendments to ensure that the commission's work is fully aligned with federal initiatives. Right now, federal and state parity laws require non-discrimination in both public and private insurance coverage as well as access. The commission should ensure that all recommendations related to coverage, reimbursement, and workforce meet this requirement. And then finally, in expanding access for Marylanders who are incarcerated in jails and prisons, the commission should actually include in its charge dealing with what's called Medicaid reentry. Through 1115 waiver authority, Medicaid will pay for health services for a set period of time before an individual's release. CMS has just now granted that authority to California and will be issuing guidance very shortly. So we urge the committee to include these additional recommendations and to issue a favorable report. Thank you very much.
Thank you, Madam Chair, members of the committee. I'm Jake Whitaker, Director of Government Affairs with the Maryland Hospital Association, here to testify in support with amendments on Senate Bill 582. Maryland hospitals care for everyone who comes to their doors, but too often patients in crisis, particularly youth, visit hospital emergency departments due to a lack of behavioral health services in the community. This bill will help significantly improve and expand Maryland's behavioral health system of care, whether through the telehealth expansion, the funding of community behavioral health clinics, or the value-based purchasing pilot program. Additionally, this bill builds on the success of the 2021 telehealth bill and extends the sunset provisions for audio-only modalities and reimbursement parity for 2 years until June 30th, 2025. We also supported Senator Giles' bill that extends the audio-only telehealth sunset. We worked closely with Senator Gile, the stakeholders, including the insurance carriers, to ensure that there was a consensus on moving forward with audio-only telehealth services for another 2 years. We are pleased to say that this bill passed this committee and the full Senate unanimously. The reason we support this bill with amendments is to align this bill with the aforementioned standalone audio-only bill. The amendments would simply require the Maryland Healthcare Commission to conduct a final study to develop a plan on a permanent role of telehealth in Maryland's healthcare system. And with that, we respectfully request the committee adopt the aforementioned amendments and report favorably on Senate Bill 582.
Okay, thank you all very much for your testimony. There are no questions from the committee, so have a great afternoon. And that will conclude the hearing on Senate Bill 582. Colleagues, you may have noticed we've been joined by Senator Bailey from Budget and Tax. He is representing that committee on the next 2 bills. So we're going to turn to Senate Bill 699, which is the Maryland Technology Development Corporation Equitech Growth Fund and Commission bill. Senator Augustine is back or still here. Good afternoon.
Yes, ma'am. I haven't left. In fact, Senator Bailey was with me in E3. We still don't even know what we call ourselves down there yet. Honestly, I'm still trying to figure it out.
Madam Chair, Madam Vice Chair, Senator Malcolm Augustine here with Senate Bill 699, TEDCO, Maryland Equitech Growth Fund and Commission. Colleagues, how do we create a culture that uplifts and unleashes tech and life sciences-based innovation and entrepreneurship for all in a way that really elevates and sustains Maryland competitiveness and unlocks opportunity for all the families in our state? The thing is, colleagues, we've talked a lot about how we have these tremendous assets here in the state of Maryland. I mean, we got world-class higher education, health systems, federal labs, amongst other things. But we really don't have a statewide strategy for innovation economy, including investment coordination and inclusiveness limits the state right now. The way that we're set up, it's really limiting us from becoming a real national leader in the space of tech and a real tech leader. And the thing about it is our competitors around the country, they are making such investments. North Carolina, they created a $200 million fund for this very reason, to create such a economy and such an opportunity for themselves. We also are keenly aware of some of the forerunners of those, the California and the Massachusetts, who have this long-standing sort of ecosystems that really support and foster that. That's something that we need to have here. We do have these tremendous assets, but we really do need to bolster our, our future with regard to growth in the tech space. Now, in 2022, there was a joint chairman's report that, of course, was set up by our leadership, collective leadership in the House and the Senate, that instructed TEDCO to seek an impactful, inclusive, measurable, long-term economic development strategy to advance just those types of technology industries to accelerate Maryland's growth and to address inequities in underrepresented communities in advanced industries. And they actually even established what they felt like that should look like. They felt like this should be something serious, something significant, establishing a $500 million 10-year Equitech growth fund. And bless you. And the thing is that that's what we were asked to do. That's what they were asked to do. And as I shared about this sort of, that's, the limitations of what we currently have, this bill aims to do just that. It really aims to create this high-tech sector in Maryland, engine of growth. And the thing is, though, if we want to keep up with the national average, we got to really boost up the things that we're doing. And that's what this fund really does aim to do. If we're going to get to a 3 to 4 year per year growth rate versus like a 1.6, I mean, we really need something that really is going to do this, that's really going to press this thing forward. And so what this bill does is it creates a fund and commission in TEDCO for the purpose of increasing Maryland's competitiveness as an innovation economy. It has to develop a comprehensive strategy to spur stronger high-tech industry innovation-led growth and make those investments to execute that growth, engage industry, diverse communities, and act quickly to remain competitive with the other states, as I mentioned, attracting and retaining industry talent across basically the entire, our entire country and the world, quite frankly. That's what this bill really does aim to do. Now, you may see, or rather you will see in your testimony that there is testimony from DBM, Department of Budget and Management. And I just want to kind of respond to that a little bit. So one of the things that they mentioned is a dependence on the growth of the budget, an obligation. As you all know, we have, given our new budget authority, we have changed our language on mandated appropriations and would be open to the May language here as well within this bill versus the mandated appropriation language. So there's that first. The second thing that they talk about is, they talk about the targets that are there and kind of not really being clear about the benchmarks and everything, but that's actually what this is about. And that's actually the expertise that TEDCO brings to this, and that they have, and that they understand. And what they really are trying to do is to just have us become far, far more competitive in this space, to become that innovation economy, retain, attract trained workers, which ties in again to our workforce development goals that we have as well, and create this more diverse and innovative ecosystem throughout our state. And with that, I will ask for a favorable report on Senate Bill 699. Go ahead, Troy. Thank you.
Good afternoon again. Thank you again, Madam Chair, members of the committee, and other folks who are visiting. My name is Troy Lamel Stovall. I humbly serve as the CEO of TEDCO. We stand in support of Senate Bill 699. Thank you, Senator Augustine, for your leadership on this matter. As he stated, let me try to really get to the part of this. This is about how do we create a culture of competitiveness, a culture of competitiveness that's inclusive, a culture of competitiveness that really puts us at the top 10, which is one of the elements that was in the JCR. How do we become a top 10 state? And how do we become a culture of competitiveness that has metrics that really show us that we're doing that leadership? And so that's what this is about. How do we move to a culture of competitiveness? And let me tell you, double down on some numbers that Senator Augustine left with you with. We're growing at 1.6% in these high-tech jobs. The average, not the best in class, is 4%. What that translates into is almost 90,000 jobs a year that we are not filling here. And these are jobs that, as you heard earlier in the cyber panel, don't require 4-year degrees and are well-paying jobs and can be in parts of the state that don't traditionally get those types of jobs. And so these are the types of things we have to do. In order to do that, as the governor has said, we have all these amazing assets, but we don't have the strategy. So there's a lot of bills that you're considering that you've heard me talk about even here, but we've got to have that overarching strategy that lets us know where are we targeting, what should we target, and how do we target this? So we stand in support of this bill. Thank you for your time and attention on this matter.
Hi, good afternoon, Madam Chair, Madam Vice Chair, members of this committee and those of other committees that have crossed the hall. My name is Kelly Schultz. I am the CEO of the Maryland Tech Council, and we are a community of 700 member companies representing about 160,000 members of those companies. And we span the full range of technology across all of Maryland. We are here in support with one very small friendly amendment of Senate Bill 699, which establishes the Equitech Growth Fund and Commission in the Maryland Technology Development Corporation. The Maryland Tech Council commends TEDCO's work, and of course, Senator Augustine, the sponsor, to release the Maryland Innovative Competitive Study, which generally found that Maryland must do more to solidify our status as a top state for innovation and economic growth. For example, the Maryland Tech Council has strong representation from the life sciences industry as part of our membership. Life sciences is an industry at risk of falling behind our competitors if we don't do more. I'm going to throw a couple more numbers out there for you. This month, Virginia announced an unprecedented $66 million in life sciences grants as part of what state leaders described as a strategic target of growth. North Carolina has directed $75 million to life sciences in recent years to launch the North Carolina Biomanufacturing Training and Education Center. Pennsylvania, Massachusetts, Texas, and California have also made significant investments in their life science industries. Such investments not only help grow the economy, but they help to achieve the equitable growth goals embedded in this Equitech concept as well. I support, and I hope you do too, House Bill 699. Thank you very much for your time.
Good afternoon, and thank you, Madam Chair, Madam Vice Chair, and distinguished members of the committee. My name is Lester Davis, and I have the honor of serving as the Vice President and Chief of Staff to the CEO at Care First Blue Cross Blue Shield, where I oversee all of our mission-driven investments and partnerships in communities throughout the Mid-Atlantic region. Put simply, a large part of my job is to ensure that CareFirst is a true partner in our shared work to build healthier communities. And by many measures, economic vitality is the key ingredient to creating stronger communities. As the largest not-for-profit health plan in the region, serving more than 3.6 million people, CareFirst is well positioned to play a leading role in the critical work to invest in inclusive and equitable approaches to diversify Maryland's economy, and also drive impactful solutions that accelerate our position as a global leader in Equitech. And that's exactly why Senate Bill 699, thanks to Senator Augustine, would accomplish. The Equitech Growth Fund is an opportunity to further elevate Maryland's competitiveness, create new economic interest, and drive an inclusive economic growth strategy for our region. As one of Maryland's largest employers with nearly 8,000 associates and contractors, CareFirst has a vested interest in helping Maryland cement its position as a national tech leader. Increasing Maryland's competitiveness as an innovation economy is directly tied to health organizations like CareFirst, where we constantly are looking to grow, retain, and attract talented workers, thereby creating a more diverse and innovative ecosystem throughout the state. And we're not alone. CareFirst is part of a growing number of institutions and companies across the state, from university systems to the state's largest public utility, that recognize the ability of Equitech growth funds to serve as a national model for thriving, inclusive tech sector and innovation economy right here in Maryland. We look forward to working with you guys. We'd ask that you please favorably support Senate Bill 699, and thank you for your continued commitment to our state's future.
Thank you. Are there any questions for the sponsor or this panel? Seeing, okay, Senator Bailey.
I just, well, it's an honor to be here with you all in finance today, but I'd like to thank you all for coming. I hear what you're saying, Senator. The fact is, I have the honor and the privilege to represent Patuxent Naval Air Station, right? And I understand when we talk about competitiveness, right? In dealing with whether it's the Navy Alliance, whether Patuxent Partnership, we work to make sure that we are competitive. And if we're not, we're off the charts. And I think that this is a good bill. I appreciate it. Appreciate every one of you coming here and bringing a bill like this. Thank you.
Thank you for that.
Thank you,
question,
Senator.
All right. Are there, Senator Reedy?
Just one question. Thank you, Madam Chair. And we talked about this a little offline, but can you talk a little bit about what TEDCO has now and what this is doing? Because this is adding money on top of funds that you already manage. And it is a big fiscal note. I mean, we agree competitiveness is important, but it's the big fiscal note.
Yeah, thanks for that, Senator. And I should have stated this, so thank you for the question. We got asked to lead this, but the real leadership for this bill is going to come from the public and private sector, from the private sector. You're going to hear from here, even more so, in addition to CareFirst. Yes, so these funds that we do have at TEDCO are investment funds that allow us to invest directly in companies. But what this is really about is investing in the innovation infrastructure. And so how do we, so it's not just about what we invest in, because we invest, most of our investments are directly investments in companies as a venture capitalist. But it does us no good if we don't have incubators, if we don't have accelerators, if we don't have access to talent. And so we are seeing companies leave the state because we don't have some of this infrastructure, this innovation infrastructure. So that's what this is about. But it's also about how do we leverage other companies and how the other entities like Maryland Tech Council, like Medco, you're going to hear from, like CareFirst. How do we take those additional investments and leverage the dollars? Because the real point of this is not the dollar, all due respect, we really do need the dollars from the state, but the real leverage is going to come from the dollars from the private sector and being able to get to those dollars, just like they did in Massachusetts, just like they've done in California, just like they've done in Texas and in North Carolina.
It's going to be an ability for private sector dollars to come in and match and perhaps
Yes, sir.
exceed what we're investing.
Absolutely, sir.
And that's how those funds can be made available.
Yes, sir.
It's not just making them available on a state investment only, correct?
Absolutely correct.
Okay, thank you.
Thank you.
Thank you, Madam Chair.
Thank you. I don't see any other questions from the committee, but if you could just to help me understand, and I think you might have gotten to it a little bit. So assuming that, and I heard the senator say the shall to may, which is helpful as we look at the fiscal impact. So can you talk to me a little bit about the establishment of the commission and kind of how that would help get things started? I
Yeah,
guess?
again, thank you for that, Madam Chair. So we believe the commission is actually just the money is important, but the commission is even as important. Because what we really need is, again, private sector led. And we see the commission being predominantly dominated by the private sector with obviously input from other sectors as well, but private sector led, number one. And being able to start to think about, start to think about and really study and really begin to understand what we should do and looking at other states and other regions. But more importantly, the reason this is where the money comes in, Madam Chair, is we've got to start doing some investments now. And so the commission will help think about kind of getting us into a study, learn, do type of loop over those years while the commission is doing its work over those first 2 years.
Thank you very much for that. Are there any additional questions? Okay, thank you very much for your testimony. We do have additional witnesses signed up in support of this bill. So we'll call forward Thomas Sadowski, Brad Phillips, David White, Drew Javin, and Brett Schreiber.
It's okay.
Good afternoon. You can get started as soon as you're settled.
Great. Well, thank you, Madam Chairman, members of the committee. My name is Brett Schreiber. Here on behalf of Fulton Bank, we're a $28 billion company here to support Senate Bill 699, which will really ensure Maryland's ability to continue to grow its competitiveness as other states are making similar investments in their economies. Fulton Bank is a driver and supporter of Maryland's innovation ecosystem. Last year alone, my division supported over 40 companies here in Maryland, injecting more than $17 million in capital in the innovation community on an average of about $500,000 per company. And more importantly, 95% of those companies were pre-revenue and pre-profit. We think Maryland's doing already a great job to support early stage companies, and TEDCO is a tremendous resource for these companies. But Maryland needs to ensure that the early stage companies in which we're making investments remain so that they can scale and grow and continue to benefit Maryland citizens. This bill will help to inject additional capital in companies, which incent companies like ours to provide critical follow-on funding for innovators and entrepreneurs in Maryland. And for those reasons, we respectfully request a favorable report in this bill. So thank you for allowing us to be here today. And great to see you all again.
Thank you, Madam Chair and Vice Chair. My name is David White. I'll be representing Tomorrow's Bio today. We are a research and development company based in Somerset County, Maryland, that focuses on using innovative technologies such as ingestible camera tablets for livestock endoscopy/colonoscopies to reduce the cost on American farmers and to allow Americans to have a better idea of what they're eating, and along with what American farmers are, the health conditions of their livestock. Tomorrow's Bio today supports Senate Bill 699 as the bill provides more Marylanders with the resources to create technology innovations, and also provides the resources in lower income and rural parts of Maryland where the youth can better be trained for jobs tomorrow. Maryland is a very diverse state. The Equitech Growth Fund will enable Maryland to access its untapped talent in its underserved communities through more inclusiveness and equity. I believe this will foster an environment of greater tolerance and respect across the state. Such an environment will not only attract Maryland's greatest assets as innovators, but also attract the attention of outside companies who feel they are not fairly represented in their current region. Maryland's research institutions are world-renowned, but the fruits of this research in the form of new products being developed often by startup companies can easily move to other states if Maryland does not provide the infrastructure and workforce to support this growth and development. As a business owner in the rural parts of Maryland, I will need skilled work, talented work for my business. Senate Bill 699 will help to generate that workforce for entrepreneurs like myself that we will need in the future. For these reasons, I support Senate Bill 699 and urge the passage of this important legislation. Thank you.
Good afternoon again, members of the committee, chair, vice chair, and sole member of budget and tax. I'm here in support of this bill. My name is Brad Phillips on behalf of all 16 of Maryland's community colleges. And I'll tell you why. When it comes to Maryland, you have some of the world's greatest research institutions, private and public, R1, R2, Morgan State, looking to be a research institution. And yet, whenever this research and development gets to the commercial phase, and the entities that have done this research look around for the workforce, it's not there. And that's what I would just literally call an unforced error for lack of having a strategic plan is what this bill calls for. When you have to actually lose all of that research and development at the very moment where it becomes economically profitable to your competitor states, it's time to rethink what you're doing, I think, in a way that would keep and retain that talent and grow it here. And I am excited because this would allow opportunity for community college, especially, to fill a lot of these niches in this innovative economy. You do not need the four-year degree for everything. It's middle skills in particular that is the gap between what the workforce needs in an innovative economy and what we're doing. So with this legislation, it would really bring us to the table. It would allow us to strategically think as a state how to retain and build on this research and development that's coming out of our universities. And I think ultimately really create an economic prosperous state that would have more than economic return on whatever money you're spending in this. So with that, I urge a favorable report and thank you very much.
Well, good afternoon. Madam Chair, members of both the Finance and the Budget and Tax Committee. My name is Tom Sadowski. I'm Executive Director of the Maryland Economic Development Corporation. Pleased to be a member of this panel today, testifying on behalf and in favor of Senate Bill 699. We've submitted written testimony, and it really kind of goes to the heart of what Medco is focused on, which is helping to build and rebuild communities, invest in infrastructure, whether it's roads, water, sewer, planes, airports or ports themselves. But our focus has taken a strategic turn into the area of innovation infrastructure, and working together with our friends at Commerce and TEDCO, we've placed a high strategic level of focus on that area because we're talking about leveraging our strategic assets, our military bases, our federal labs, our higher ed institutions. And when you really think about where those assets reside in Southern Maryland, in Western Maryland, in our cities and in communities that are really in need of investment, that really magnifies the importance of this discussion, doesn't it? Placemaking, innovation infrastructure, startup creation, support, and sustainability, all those things become so valuable. Maryland ranks #1, according to the Kauffman Foundation and the National Science Foundation, in academic R&D per capita, but it only ranks 28th in terms of industry R&D, commercialization, if you will, output. We only rank 40th in terms of startup survival rate. Those are lagging indicators by any stretch. Maryland can and should do better. And I think we've already made great strides. I've been here to testify before you on some really terrific pieces of legislation related to the Blueprint for Education, cyber workforce, innovation infrastructure, manufacturing industry 4.0. We're making some of the right moves, I think, this session in addressing our competitiveness. What's lacking is this coalition of the willing, as Troy likes to say, stakeholders from government, industry, and higher ed acting together to make sure we're making the right investments and measuring our performance over time. So I ask for your favorable report on Senate Bill 699.
Thank you very much. Senator Mounts.
Thank you, Chair. I'm sorry, I missed your name. Somerset County.
David White.
Mr. White, thank you for coming up to testify. I didn't hear the name of your company.
Our company's name is Tomorrow's Bio Today.
Tomorrow's Bio. And are you working with UMES or are you?
Actually, I am, I've done it all on my own. We started with basically no money, and I kind of had to build myself up, which is why this bill is important. I was a paraprofessional. I don't know if you all know what that is, but as essentially a teacher's assistant. With that position, you make between $14 and $15 an hour. It is not a livable wage. I had to learn about technology. And because I learned about technology, I was able to develop a piece of software that allows us now, well, we actually were able to just demo it last week. We created a piece of software that as soon as the camera connects to an outside network, whether it be a hotspot or a Wi-Fi network, it will begin to take images and then upload those images onto Google Drive. So that's going to allow us for the tablet to be swallowed by a livestock, whether it be a cow, a horse, or a pig. And then from there, the images will be sent directly to that person's phone as well as to the veterinarian's phone. That's going to decrease the amount of time veterinarians have to be out in the field. It's going to decrease the amount of injuries or deaths that are caused to veterinarians by trying to do colonoscopies. And it's also going to increase the amount of money in farmers' pockets because it's going to decrease the amount of money that it costs to do these types of procedures.
Did you submit written testimony also?
Yes, I did.
Okay, I wasn't able to find it, but I'll track it down. Thank you.
Thank you.
you
Oh,
for
and
coming.
in that written testimony, you might see that it has Senate Bill 688 instead of 699. That was a typo on my part.
Yeah, I got to share a confession with you. I was gearing up to line some questions to say, why doesn't any of this money ever go to the Eastern Shore? And the Eastern Shore never benefits from these programs. So I'm glad you were here to testify today. So
Thank you, sir.
Thank you, Senator. I don't see any additional questions for this panel. Thank you very much for your testimony. And that will conclude the hearing on Senate Bill 699. Colleagues will now turn to Senate Bill 804, which is Maryland Technology Development Corporation Community Technology Program for Maryland. Senator Ellis, good afternoon.
Good afternoon, Madam Chair. Arthur Ellis, Senator from District 28, Vice Chair Klaus Meyer, members of the Finance Committee. I'm here to present Senate Bill 804, having to do with the Community Technology Program for Maryland. And almost a year ago, the president of the Maryland and the NAACP state chapter approached me about a legislation to allow communities throughout Maryland to know about technology programs, training programs for young folks or not so young. Because it seems like if you are in the know about some of these programs, then you can get into them, you can get your children into them. And if you're not, then there's no place to go to really get that information to find out what is going on where community members can upgrade their skills. We hear about pipelines, right? STEM pipeline, we know about the school to prison pipeline. And the pipeline we think about generally the school and the home. But that conduit runs through the community. And we need a lot of community organizations to really work with the schools and the homes to prepare the workforce of the future. And like several bills we've heard today having to deal with technology, Maryland has a tremendous potential to really increase opportunities, high-paying opportunities for our citizens in technology. And so this program, this bill is meant to bring in the community to opportunities that exist in the state. So one of the things I want to do is a little different is to go through the preambles to this bill. It's not many. Whereas school system cannot provide all the necessary activities that attract students to positive learning. You know, the community have to be involved. Whereas nonprofit entities are well established in local counties, but outreach and business and government entities lack. One of those institutions that my family has benefited from is 4-H Extension Service and Technology Robotics Program through 4-H. Another, whereas initial startup costs are not readily available to local organizations to position themselves to offer these services, and these services are not provided by local governments. And then we look at the issue of equity. Equity and access to technology education and certification are challenges for youth and certain members of the Maryland community workforce. And we go forward, therefore, there's value in funding technology hubs, community spaces, and STEM learning centers for residents in Maryland. So that establishes the need. Let me get to the mechanics of this legislation. This legislation will create a community technology program for Maryland. The program will provide services that promote after-school technology clubs, will establish learning centers for individuals seeking basic technology skills for employment, and provide individuals in the community with the necessary skills to use technology to obtain essential services from government. And let me skip over. In the interest of time, I just want to talk about where this program will land. So we don't want to create a new agency. So after many weeks of back and forth, decision was made to land this program in TEDCO. And they were here on several bills earlier. So I have a letter from TEDCO. It says the Maryland Technology Development Corporation, TEDCO, is dedicated to economic growth through the fostering of inclusive, entrepreneurial, and innovative systems. TEDCO thanks the bill sponsor, which is Arthur Ellis, for his interest and leadership on this legislation. And we support the concept of this legislation. And so it goes on to the proposed legislation will require TEDCO to establish a program to issue grants to each county to develop technology clubs, learning centers, and skills and provide training programs for members of each community throughout Maryland. So we'll work with local counties and local jurisdictions to set up these technology hubs, which will help all of Marylanders to have access to technology program from birth through senior years. So with that, Madam Chair, I ask for and committee members favorable report on Senate Bill 804.
Thank you, Madam Chair. Thank you, Senator Ellis, for co-sponsoring this bill and taking it to where we are today. Simply put, the time has come for this type of investment in community, so that all of the testimonies earlier about the high level of technology, whether we're talking about startups, we're talking about businesses. The reality is, if we don't have the workforce, Americans can't get these jobs. And what this bill does, this is Senate Bill 804, what it does is gives an opportunity for pipeline, as mentioned earlier, so that young people and anybody, speaking specifically about young people, they can gain the skills so that they can be either innovators or they can be a substantial part of the workforce. Right now, that doesn't exist. But we have examples of how it can exist when you look at the process to youth sports, whether you're talking about baseball, basketball, or whatever. There are 10 to 12 week seasons where they participate and their skills advance each and every year. And we're saying to do the same thing with robotics. We're saying the same thing with coding. We're saying to do the same thing with other details of machine learning and AI. And in addition to that, in a season where we're saying that people are being automated out of their jobs, this gives an opportunity, when we're talking about technology hubs, to be in the center of the community so that all citizens can have a place where they can advance their skills if there's a need be. And we're talking about aging adults. So my name is Willie Flowers, and I'm the president of the NAACP Maryland State Conference, and we urge a favorable report on this bill.
Good afternoon, Madam Chairman and members of this committee. I'm here to advocate for this bill. I think it's strongly and necessarily important. Oh, sorry about that. I really do believe this is extremely important. As you heard earlier today about cyber, about different technologies coming into our communities, the workforce isn't there, and that's because the lack of education towards these type of technologies. So I'm a huge advocate of what Senator Ellis is proposing. I'm here to support Willie and advise him on best ways to help out with putting this stuff together and be hopefully a beacon of light to younger people in our community to push them forward in this arena.
Madam Chair, members of the committee, thank you for the opportunity to speak before you. My name is Michael Butera. I am the chair of the State Conference NAACP's Technology Task Force. I'm also a small business owner out of Howard County, focusing on the ability of nonprofit organizations to promote better results for citizens in general. We have placed an enormous amount of pressure on our public school systems to provide all the necessary education and training, whether it be pre-K through graduate school, in the technology field. As has been noted here today in several other bills, it's not always necessary for everybody to get an advanced degree in order to be successful in technology. What we want to do here, and what is important, is to engage the community in partnerships at the grassroots level. So this isn't a matter of just government or employee representatives or for-profit or nonprofit businesses. It is, as I like to say, if you look at your keyboard, a shift 7. And if you look at shift 7, that's an and. And what we need to do is think about this in terms of what we can do together to promote these kind of activities, not just for young people, but for people who've lost their employment and need to get these skills. And in terms of government, think of all the efforts we have in government for people to use technology for services. Some people don't have those skills. It's time that we create community partnerships of the nature that I suggested so that we can do all that. And I urge a favorable report from the committee. Thank you very much.
Thank you very much. I don't see any questions from the committee. Sir, in the middle, we didn't catch your name, if you could.
Evan Figueroa.
Okay. Thank you very much. And seeing no questions from the committee, we thank you all for your testimony and for participating in Senate Finance. That will conclude the hearing on Senate Bill 804. And we will now turn, I saw Senator Sidnor in the back, so we'll call him forward and bring up Senate Bill 479, which is the Department of Small Minority and Women-Owned Business Enterprise Establishment and Duties. Good afternoon, Senator.
Good afternoon, and thank you for having me, Madam Chair. My first time to be in your committee in this new role. So Senate Bill 479, or I should say the purpose of Senate Bill 479 is to make real in Maryland some of the national goals that were set and established by President Nixon in his executive order creating these particular types of vehicles. The goal of Senate Bill 479 is to bring into existence a vision that the General Assembly also had just about 50 years ago about an agency that was going to ensure economic justice and opportunity for entrepreneurs. When I was first elected to the House of Delegates, MBEs and the issues surrounding were some of the issues that I wanted to address. There have probably been a handful of bills that I've introduced since I've been in office. And just recently, I looked at MBE's oversight studies last year, which I used to contemplate this legislation. This particular report was put together by DLS and issued in January 2022. And it listed a number of items or recommendations for how Maryland could improve its MBE program. Senate Bill 479 is an actionable response to those findings and recommendations detailed in that particular study. And the bill really, when you kind of get to the nucleus of this, it does 4 things. It elevates the governor's office to a department. It establishes a state board for contract preference appeals. It establishes a development office to help develop these businesses that qualify, and it creates a small minority business development fund. So if I were to take each of these. With regards to the State Board of Contract Preference and Appeals, one of the things that was mentioned in this particular report that it was that the state had limited resources and the authority to resolve often frequent disputes between MBEs and prime contractors. This particular office or this particular appeals board would be set forth with 6 full-time state compensated members who would be appointed by the secretary to hear those types of appeals from our MBEs. The idea of the development office, that idea is, again, I think we've had mentoring programs and the like. What was put forth was that the MBE program does not facilitate growth and self-sufficiency of our minority and women-owned firms. This particular office would be set in place and have a variety of programs to actually address that and make it a reality that we're actually growing some of these small and minority businesses. Financing has always been a major issue for the businesses, so that's why this bill would also create a vehicle for that particular financial assistance. So with that, I will cede the rest of my time and stand for any questions you may have.
Thank you very much. Vice Chair.
Yeah, Senator, do you know anything about the Croson studies?
The Croson studies?
Yeah, are they involved with this?
I do not know, I'm sorry.
Because
Is
I
that
have
based off of the Croson decision back? Is that what you're talking
yeah,
about?
and so the only reason I'm asking, because I am not that familiar with it, and I had a bill a couple weeks ago having minorities and women do some aquaculture, and they said it was unconstitutional. I couldn't do it, so so we had to kind of rearrange it. But the Department of Transportation is the one that administers that. So,
Right.
But
Okay.
I didn't know if you knew anything about it that you could help me out with it. So.
I know that's probably referring to a court case from back in the 1990s that put some parameters around.
Right. So
Right.
I don't know if that affects you or not in your bill. So,
Got you.
okay. Thank you.
Thank you.
Thank you. Senator Mounts.
Thank you. The bill creates, is this a new administrative appeal?
Right,
forum?
that would be a new, right,
Okay.
correct.
And that would be a forum that'd be utilized by MBEs that are excluded from a contract or a procurement that is awarded that does not meet the MBE guidelines, or how does that?
It would capture all of that. One of the other issues that many of these businesses have had is issues with being paid on time and the like. So I mean, if they're a part and they have this contractual relationship, they could avail themselves of this particular process.
And how are those grievances currently addressed?
From my understanding, they work with their procurement officer and try to address them. At that point, I'm not exactly certain what comes after that.
Okay. Well, the reason I'm asking is the MBE participation on the Eastern Shore is not good.
It's not good across the entire state.
And it's a huge challenge
Right.
for us. And I appreciate you putting the bill together.
One of the reasons for this is you would like, the idea is having something that's centralized. Moving from a office of the governor to a principal department would then put that secretary at the level of all other secretaries. And that's the idea, just putting a bit more clout behind the person who's running this program, and making certain that it has resources and having one person that you can go to rather than, I mean, right now with these programs, as Senator Klaus Meyer had noted, the certification is ran out of MDOT. All of our agencies then have their MBE procurement officers, but really, there's no one sticking place to go to at again, at the secretary's level. So it would be essentially elevating the governor's office of small and minority businesses to a secretariat level. So he or she would be that person who would be the go-to person.
Okay, and then after that administrative appeal, there would be a judicial appeal. Right?
The bill didn't go into that, but I would assume that if that's part of how that natural process, that would probably be the case.
Yeah, because ultimately to get to the point to where this is enforced, that's what you'd want to have,
Correct.
right? There's a
Right.
Finality.
Yes,
So, but
I agree.
thank you.
Thank you. Senator Lamb.
Thank you, Madam Chair. Just a quick technical question for the
Yes, sir.
sponsor. And wanted to see if you were aware of this or if you may want to consider an amendment. The bill, well, in current statute, it states that there are 21 principal agencies, principal departments rather. And with the governor's executive order establishing the Department of Service and Civic Innovation, that is actually the 21st department. So if you were to want to move this bill forward, you would actually need to also amend that part of the statute to allow for 22 principal departments.
Thank you very much. Appreciate it.
Thank you.
Thank you, Senator. I don't see any additional questions, so thank you very much for
Thank
your
you very much for your
testimony.
time. Thank
That,
you all.
that concludes the hearing on Senate Bill 479. We're now going to turn to Senate Bill 772, which is the State Board of Nursing Peer Advisory Committee's scopes of practice and licensure requirements. Senator Lamb, and you can bring your panel up.
All right, thank you, Madam Chair, members of the Senate Finance Committee, here to present Senate Bill 772. For the record, Clarence Lamb, Senator in District 12. This bill is a technical cleanup bill for the General Assembly, for a bill that was passed by the General Assembly a few years ago, back in 2021, to create a license for certified midwives. Our committee had heard about direct entry midwives earlier this session. But this bill is dealing with a different class of providers called licensed certified midwives, or LCMs. Licensed certified midwives have the same qualifications and scope of practice as certified nurse midwives. Certified midwives and certified nurse midwives attend the same graduate programs. So they both attend the same graduate programs, take the same national exam, and are certified by the same certification agency. The only difference here is that the certified midwives enter graduate school with a non-nursing bachelor's degree. They need to have the same science prerequisites, but many LCMs were first interested in a different clinical field during their undergraduate studies, such as pre-med potentially, but then for graduate school decided to move into midwifery. We created a licensure back in 2021 for certified midwives to help address the ongoing shortage of pregnancy care providers. Throughout the state, there are areas with limited numbers of providers, and our outdated law was preventing qualified providers from practicing in Maryland. Midwives provide person-centered and community-centered care. By creating a new pathway to obtain licensure as a certified midwife, we are bringing diversity to our midwifery community. Midwifery faculty reports that it is not uncommon to have foreign-trained physicians decide to become certified midwives rather than engage in a lengthy process to obtain their physician's license here in the United States. This year's bill is essentially a cleanup of the bill from 2021, when the American College of the Nurse Midwives started working with the Maryland Board of Nursing on regulations for licensed certified midwives. There were a handful of items that came up that were inadvertently missed in the 2021 bill that created discrepancies in the statute for certified midwives and certified nurse midwives. So this bill addresses those issues and ensures the two professions are aligned as intended from that original 2021 legislation. Just before I submitted this bill, I received a constituent email about the last birthing center in the state closing at Luminous Anne Arundel Medical Center. This means that the state has no birthing centers at all, despite the fact that this committee has heard many people who are looking for birthing facilities that are less institutional and more community-based than hospitals. The lack of birthing centers pushes more families to have to decide between hospitals and home births. I'm not certain what has led to the closing of all Maryland birthing centers, but I believe it's important that we work to find out the cause of this and try to address it. So I've included a provision in this bill that asks the Secretary of Health to consult with interested stakeholders to identify strategies to increase access to birthing services at birthing centers. Some of these strategies could be regulatory, financial, or legislative, and we hope to find this out before the next session when the Secretary of Health reports back to the General Assembly to decide if we can take any steps to address this in the next session. Yesterday, I also received technical amendments from the Board of Nursing that they submitted with their testimony, and I plan to review those and also request any additional sponsor amendments that may be needed. With that, let me close and hand it over to other members of the panel. Happy to answer any questions after they give their testimony as well.
Good afternoon, Robin Elliott here today on behalf of the American College of Nurse Midwives, the Maryland affiliate. I will be brief. I was the one tasked to work with the Board of Nursing to develop the regulations to implement certified midwives. It's very detailed. The statute under the Board of Nursing is a little bit patchwork, so it's not too surprising that there were a couple of areas where we needed some change in statute in order to make all the regulations across the certified midwives and certified nurse midwives to align. So that's what you have in front of you. We work very collaboratively with the Board of Nursing, and I believe that their technical amendments align with the original intent of this bill. Thank you.
Good afternoon. My name is Jan Krebs, and I am a nurse midwife and also a midwifery educator. So I am primarily here to answer questions.
Hey, Senator Reedy.
Madam Chair, and I've been involved with the midwife issues with and we have some issues in the committee about birthing that are here before us as well. When I'm looking at the drug dispensing, so it's allowing a nurse midwife to be, or just a midwife to dispense starter drugs. Can I understand that better?
Yes, a certified nurse midwife and a certified midwife. This is separate from anything with the LDEM.
Okay.
They have they actually don't have any prescriptive authority.
Okay, but we're allowing, do current certified nurse midwives have prescriptive authority already?
Yes. So
Okay.
certified nurse midwives and certified or nurse practitioners and certified midwives all have prescriptive authority.
They all have prescriptive authority for the same types of drugs?
It's within, yes, it's within their scope of competence. So a nurse practitioner who focuses primarily on pediatrics will not be prescribing oncology drugs, for example.
Right, of course, okay.
Nurse practitioners and nurse midwives both have dispensing authority, but when we went back to compare the statutes, they were slightly different. So they can dispense within hospitals, they can dispense within nonprofit clinics. Nurse practitioners can dispense starter dosages, and Ms. Krebs can certainly kind of list out the typical kinds of starter dosages. But technically, we discovered when we did this comparison that nurse midwives could not. So we wanted to sort of fix the issue for certified midwives, and we thought we should just make nurse midwives, certified midwives and NPs just parallel. And it's, by the way, the starter dosage language is identical to the PAs and physicians. So it all looks alike.
But so the only people that are being given something new are the certified nurse midwives, or I'm just trying to understand, is there anything new at all? It sounds like there's one that's new.
So the one that's new is certified midwives. They can prescribe, but in the 2021 bill, there was not clear dispensing authority. So this bill would create clear dispensing
Just
authority.
like all the other occupations.
Correct. And then the other thing that is we were working with the Board of Nursing and discovered that we needed to make it clear that certified midwives could delegate to a certified nursing assistant in the same way as nurse midwife could. So certified midwives and certified nurse midwives could work side by side, and that's the vision, work side by side at hospitals or birthing centers if we can get them back up and running. And so it's really important for both of them to be able to delegate to a CNA, the task that all of us kind of think of CNAs as doing.
Right, right. Could you, at your convenience, I'd like to see what the difference in the training and the standards are, like what they're dispensing versus what they're not. What's the difference between nurse midwife and midwife as it relates to what drugs they have access to?
Well, I can answer that because I actually teach in a program that educates CNMs and CMs side by side. And I also happen to sit on the board for our certifying body, the AMCB. There is no difference. The difference is in what you come in with, not what you graduate with. Same board exam, same pharmacology classes, same clinical experiences, same certificate. Just were you a nurse first? Or do you have a degree in something else?
Gotcha.
And the appropriate prerequisites?
Gotcha. Okay, that's good to know. And then finally, we passed laws changing our abortion statutes and allowing for, have we gotten scope of practice created for that yet, as far as what training you have to go to? As it relates to dispensing, I'm curious because obviously we have, abortion related drugs. So where are we at with that?
So the way that the statute is set up under the Abortion Care Access Act, under the existing scope, it would be within physicians, nurse midwives, certified midwives, and PAs to prescribe medication abortion or to provide procedural care.
Is that the case now, or we need this bill?
It's the case now.
Okay.
The only difference is the dispensing. And right now, there was a change in FDA rules. So that if we're looking at medication abortion, what could happen is CMs aren't licensed yet. We don't have the regs yet. But in theory, when we get those regs, the CM could prescribe for the medication abortion. And even without this bill, the prescription would just go to a pharmacy to get dispensed.
But the other ones on here can dispense now, even without this bill.
Right. One of the underlying issues that dispensing is important, if we think about looking at the birthing center piece, one of the things we do know, and we heard from the most recent center that closed, is that a lot of the reason was because of staffing issues. And so being able to have certified midwives be able to do the exact same things, certified nurse midwives, sorry, it's a lot of acronyms, would be really helpful to address those staffing issues in birthing centers. And so this really aligns with the goal of looking at that issue, which would be something, I know it's kind of a last minute addition to this bill. Literally that birthing center closed in January. I think it may have closed in February. It was announced in January, the last one in the state of Maryland. So really being able to get to
We'd like to get more
why.
of those back up and running. Yeah.
Absolutely. Absolutely. And the staffing is a huge part. There are not enough nurse midwives, and hopefully soon we'll have certified midwives being able to work there.
Okay, thank you. Thank you, Madam Chair.
Thank you, Senator. Are there any other questions for the sponsor of this panel? Seeing none, thank you very much for your testimony. We do have one additional witness signed up, Deborah Brocato. Signed up in opposition to the bill. Good afternoon.
It's almost evening.
Yes, it is. And we'll still be here when it is.
Thank you, Madam Chair, and thank you, members of the committee. I'm Deborah Brocato from Maryland Right to Life. As written, and we do oppose Senate Bill 772. As written, Senate Bill 7072 diminishes professional standards of care The Abortion Care Access Act of 2022 removed the physician requirement, and as was discussed by the prior witness, and it just opened the door to many other people providing surgical and chemical abortions, that says Maryland that as long as they are licensed or certified by the state of Maryland. We looked at, if you look at pages 4 and 6 of this bill, and the other witness talked about it, the nurse midwife is able to delegate duties to the medical technicians and certified nursing assistants. Not sure what those duties would be, but she did discuss about dispensing the chemical abortion drugs. So Maryland Right to Life sees this as a further deterioration of care given to the women and girls of Maryland, especially when it comes to prescribing and dispensing lethal chemical abortion drugs. The National Institute of Health article talks about over at least 20 deaths as a result of chemical abortion drugs, including 9 from sepsis, 4 from drug toxicity, ruptured ectopic pregnancy. And their conclusions were significant morbidity and mortality have occurred following the use of mifepristone as an abortifacient. A pre-abortion ultrasound should be required to rule out ectopic pregnancy and confirm gestational age. And these statistics were from when women were actually required to go to a doctor's office and get these drugs, where she might have received a physician's exam to determine gestational age and determine if there is an abnormal gestation like an ectopic pregnancy or a molar pregnancy. So Senator Lamb calls this a cleanup bill. The way the Maryland Right to Life looks at this, we think it'll create bigger messes. Medical scarcity in abortion practice is a matter of medical ethics. OBGYN see the unborn baby as a human being. Considering all the dangers of chemical abortion drugs, we do urge an unfavorable report on Senate Bill 772. Thank you.
Thank you very much. I see no questions from the committee, so we thank you for your testimony. And that concludes the hearing on Senate Bill 772. Colleagues, we're going to turn to our final bill on the agenda for today, and that is Senate Bill 774. And that is the Maryland Pathway to Nursing Program and Advisory Committee establishment. I see the panel coming forward, so good afternoon.
So I think on the panel, we have Aaron Dorian, Christy Dreyer, Brad Phillips, Mary Kay DeMarco. Also would like Jennifer Lynch to come up in place of Joshua Greenberg, who she's representing Baltimore County government. So Chair Griffith, members of the committee, happy to be here to be able to present to you Senate Bill 774. For the record, Clarence Lamb, Senator in District 12. So we have heard multiple times during this session about the healthcare workforce crisis that we are facing nationwide, including here in the state of Maryland. This crisis will only likely worsen unless we take some initiative and action. Many roles within the healthcare workforce are affected, and nurses are by no means any exception. The pandemic has placed an even greater strain on our nurses and led to widespread burnout. In fact, a 2022 study by the Maryland Hospital Association found that 1 in every 4 hospital nursing positions are vacant, and that 62% of those surveyed by the Maryland Board of Nursing, licensees and certificate holders, thought that they would be leaving nursing very soon. To keep up with healthcare demands, we will need an additional 13,800 registered nurses and over 9,000 licensed practical nurses by the year 2035. These concerning statistics are what this bill is intended to address. I introduced this bill after conversations with nursing educators about the high rate of attrition for nursing students. With nursing schools full, we cannot afford to lose any more students. However, attrition rates among nursing students is about 25%, with even higher rates for minority and low-income students. The research shows attrition rates for nursing students is high because nursing students tend to be older, with more family obligations, including childcare and elder care. They also tend to have to work while in school. Many nursing students work their way through school as certified nursing assistants or CNAs. While their CNA experience enriches their education, it can also cause logistical challenges for students trying to balance school and clinical schedules. This bill establishes a Maryland Pathway to Nursing program within the Maryland Department of Health. The primary goal of this program is to help alleviate the shortage of nursing professionals by increasing the graduation and licensure rates of nursing students. The program also strives to increase diversity within our nursing workforce. The program would accomplish this by providing financial assistance to certified nursing assistants who enter licensed practical nursing educational programs if they intend to practice within the state or continue on to become a registered nurse in the state. The financial assistance would help cover tuition, computers, textbooks, and living expenses. As a starting step, this bill calls for the implementation of a pilot program that will be conducted at 2 community colleges in geographically diverse areas. The Secretary of Health and the Maryland Pathway to Nursing Advisory Committee will be responsible for determining the details of the pilot. The advisory committee will consist of numerous stakeholders, such as representatives from the Maryland Higher Education Commission, the Board of Nursing, community colleges, higher education institutions, the Maryland Nurses Association, and the Maryland Hospital Association. The department will then report to the General Assembly so we can best decide how to extend the program. This innovative program has a precedent here in the state. Just a few months ago, Baltimore County Executive Johnny Olszewski launched the Public Health Pathways program based on similar principles in this bill. We have a representative here from Baltimore County to be able to discuss the implementation of that program with Dr. Lynch here. I've received the letter submitted by the Maryland Department of Health expressing concern that this program may make more sense to be located in MHEC or the Department of Labor. I'm not opposed to those ideas if it is the committee's preference, but I want to point out that the Department of Health currently administers the Loan Assistant Repayment Program for physicians, physician assistants, nurses, and nursing support staff. These programs were placed under MDH because of the issues that MHEC had in running those health-oriented programs. Additionally, MDH has more expertise, in my opinion, on the state's healthcare workforce needs. And that's also one of the reasons that the current healthcare commission to study the shortage of workforce in healthcare facilities is also based out of, in large part, out of the Maryland Department of Health. Additionally, I saw the department's concern about the potential cost of the bill. We were very deliberate in providing as much flexibility as possible for the department. In the long term, the state may need to invest more in our healthcare workforce, but this, as introduced in this bill, is envisioned just to be a starting pilot program based on the level of funding that the governor and the secretary would like to invest in this effort. And finally, I've submitted an amendment to also include HFAM, the Healthcare Facilities of Maryland, and Leading Age on the work group to ensure that we were looking at the staffing needs for nursing homes. With that, let me close and happy to turn it over to other members of the panel here and to take any questions at the end.
Good afternoon again. Chair, Vice Chair, members of the committee. My name is Brad Phillips, and I'm here from the Maryland Association of Community Colleges in support of this legislation on behalf of all 16 members. I will be more brief on this bill. We have experts that will talk specifically about community colleges, but I will say from all the testimony that we've been hearing today on the workforce shortages around nursing and allied health fields, that we have to really begin to think about this in a dire situation. We're losing ground instead of gaining because of the pandemic and the massive retirement of one of the largest generations in American history that will take their skill set out of the workforce and begin to utilize and consume healthcare in an unprecedented manner as the largest generation. So we really have to think about how are we going to fill that workforce loss on top of the already workforce shortage we have in nursing. We think that this bill is a start at maybe piloting something that might work across all 16 community colleges and across the state, and helping those students that are financially vulnerable would be a good step in making sure that we fix some of the retention problems that we're having currently in our programs. And with that, I'll hand it over to some of the experts on the ground.
Good afternoon, Madam Chair, Madam Vice Chair, members of the committee. I'm Christy Dreyer. I'm Vice President of Academic Programs at Cecil College, and formerly I was a Dean of Nursing and Health Professions at the college as well. Thank you for your time today. I'm here to voice my support for Senate Bill 774. I don't need to repeat all the statistics. You heard them. We have a crisis in nursing and in healthcare providers. The need's well established, and we're reaching a critical juncture. We want to provide nursing care for our citizens in Maryland, but we're going to be lacking the nurses to do so. This issue demands creative and innovative ideas, and this pathway program is designed to bring together stakeholders in workforce, education, and healthcare to try to pilot an innovative idea to meet this need. Speaking as a community college administrator and an educator, community colleges have been at the forefront of providing excellent nursing care at all levels to a diverse population for many years. Colleges are located in the communities they serve, providing the opportunity to educate a workforce that is similar to the population they serve. Community colleges have a longstanding tradition of providing healthcare access to underrepresented populations and providing excellent, affordable education that adapts to meet community needs while supporting our students is a hallmark of community colleges. Our students are often the most under-resourced and yet the most determined to meet their goals. There's no doubt that community colleges are competent. I think our NCLEX pass rates for LPN and RN programs across the state attest to this. However, our students often face financial and social challenges that impact their ability to complete an educational program. I have lost count of the number of stories that I could share with our students with what we would consider small stressors that have stopped their progress. This bill and the wraparound services would mitigate many of these issues, facilitating successful completion. So I urge your support for this. Thank you.
Good afternoon, Madam Chair, Vice Chair, and committee members. I'm Mary Kay DeMarco. I'm the Nursing Program Director at the Community College of Baltimore County. I'm also the past president of the Maryland Nurses Association. I am asking for your support for Senate Bill 774, Maryland Pathway to Nursing Programs. The bill will do two things, as we heard from Senator Lamb. It will support educational mobility for certified nursing assistants to become LPNs. LPNs are an untapped source of workforce in the state of Maryland, and we think this bill will be an area that could grow community colleges and the workforce. It also will put together a committee that will look at establishing other pathways where perhaps high school students can begin their coursework to get into community college and further their education into the nursing profession. You've heard the statistics on the current workforce. We won't go back to that. It is in our written reports, but we've heard this afternoon from other groups as well. There is a shortage of workforce for healthcare and particularly for nursing. I've been a community college educator for over 30 years. I've stayed in the position for one reason. Community college education changes lives. There are several people on this committee that started their education in a community college, and look where you are now. We can do this for others with your help. As a program director, I'm in the unfortunate position to listen to students. Over 20% of my students at CCBC do not make it past the first year of the program. This is not because they're not intelligent, hardworking. They have no support system. They are working full-time. Some have 2, 3, 4 children. They have a spouse. They just can't find the time. Please, we are begging for your support and a favorable report on this bill.
Thank you. Good afternoon. My name is Jennifer Lynch. I am the Senior Policy Advisor for Education and Workforce Development for the Baltimore County Executive. Right now, across the state of Maryland, we've heard about our workforce needs in healthcare. In Baltimore County alone, we have over 1,000 job postings for nurses, over 200 for certified nursing assistants. And despite these vast openings right now across the state of Maryland, far too many of our residents are unemployed or underemployed. In Baltimore County, we have designed a comprehensive program that will support our healthcare workforce by connecting our residents with opportunities to pursue a career in nursing, just like some of the programs we've outlined in this bill. The Public Health Pathway provides wraparound supports from application through graduation. Our participants receive full scholarships, wraparound supports, tutoring, special test prep and professionalism courses, mentoring, and case management. They have a customized work and education schedule and stipends that allow them the dignity to address their own workforce barriers, such as transportation, childcare, and housing. We are proud that this program has received national attention, but more importantly, we are proud that this program is resonating with all of our job seekers in Baltimore County. We currently have 574 interested applicants for 30 available slots, 574 for 30. We have leveraged ARPA funding and private partnership funding for this project, and we are ready to go to scale. I sit before you today to humbly ask for continued support and investment from the state. We in Baltimore County will certainly learn valuable lessons along the way, and we stand ready to share them. We believe that this program is reimagining workforce development. It will improve economic mobility of our residents, as well as support the critical healthcare workforce shortages around the state. I am here to ask that you support SB 774 so that we can continue to do this most important work. Thank you.
Thank you, Madam Chair, members of the committee. I'd like to thank, for the record, Erin Dorian, Vice President of Policy for the Maryland Hospital Association. I'd like to thank Senator Lamb for introducing this important piece of legislation. You've heard a lot of healthcare workforce development bills this session and over the last several sessions, actually. What's different about this program proposed in Senate Bill 774 is that this bill seeks to address the social drivers that may cause a person to be unable to complete an educational program. Studies show on average that almost a quarter of nursing students will drop out of a nursing program, most either in or after their first year. Supporting a student's ability to complete an educational program by providing students with access to financial assistance beyond tuition assistance will support non-traditional students in completing a further educational program. This not only will grow our workforce, but it'll grow the diversity of our workforce. And this is something that MHA and our 60-member hospitals and health systems have been keenly aware that we need to do over the next several years. For these reasons, MHA urges a favorable report on SBill 774. Thank you very much.
Thank you. I think everyone spoke, right? Okay, the vice chair has a question.
Yeah, thank you very much. Very interested. And the first question I have is for CCBC director. Do you have enough instructors to go? I mean, because in years past, that's what I've always heard, that part of the problem in this whole situation is we don't have enough.
You're correct that historically that has been a problem and is a problem to attract nursing faculty. Currently, I can say we are down one faculty member of about 35 in our whole program. We have been able to attract younger people. We're pleased about that. And we think we could expand to include more LPN education as well as RN education.
And is the idea to get more LPNs or RNs, or to go for an LPN and then go to RNs?
So we're looking at the idea of stackable credentials where they can come in as a certified nursing assistant, work part-time, but have some resources to fund these wraparound services, get the LPN, perhaps work a little bit there, and then if they desire, transition to the RN program.
Okay, is your program at Essex?
Yes, it is. I know that's your alma mater.
I know. And I just want to say to Dr. Lynch, did you find a parking place okay today?
I will, yes, ma'am.
Okay, thank you. We had that whole conversation yesterday, so, but, and one other thing is that you might want to look at the EARN program. It's employment advancement right now. That might give you some more dollars.
Thank you.
Thank you.
Thank you very much. I don't see any additional questions from the committee, so thank you all very much for your testimony. Have a good afternoon. We do have additional witnesses signed up on this bill. We'll call Robin Elliott, Aaron Greenfield. All right.
I think Aaron Greenfield is not here, so I will be brief. Robin Elliott, I guess I'm the closer for the panel, representing the Maryland Nurses Association. Just like to mention sort of thoughts about the bill in the fiscal note, because I know that's always important. One of the things I've noticed is this is the only bill in this session that actually creates a program to address the nursing workforce shortage. And as you heard, the focus is really on the beginning of the nursing education pathway. You heard about some of those attrition rates. They're very high, 25%. They are higher for Black and Brown students, students whose English is their second language. So if there's a way that we can wrap around and support their success, they can then go on to be LPNs. And then, as you heard, if they choose, be RNs. This bill currently does not have any funding. We're very much kind of looking for that. We're looking for opportunities. We're looking for options. We still think even if funding isn't identified this year, that's really important that the advisory group go forward, because one of the things that they're going to do is figure out, what does this program look like? What kinds of wraparound services? What is the average cost per student of supporting? What kind of size of a pilot can we look at? And we think that's very valuable information that could provide a roadmap to the following year. So I'm not giving up on funding for this upcoming fiscal cycle, but just wanted to put in a pitch that the advisory committee is still valuable. So thank you.
Thank you very much. Are there any questions for this witness? Doesn't look like there are any. So thank you very much for your testimony. Have a good afternoon. We have one final witness signed up on this bill, Deborah Brocato. And she signed up in opposition. Good afternoon again.
Good afternoon again, Madam Chair and committee members. Again, I'm Deborah Brocato from Maryland Right to Life. And first, I do want to say that I believe the panel has some very good intentions, but let's not let those good intentions end up with unintended consequences. While providing support for certified nursing assistants and licensed practical nurses to become registered nurses is a positive in general, we oppose the program being used to recruit participants into the abortion industry workforce. We oppose any funds for this bill being used to fund the training of participants for the abortion industry. And I will say I'm a retired nurse and I come from a family of nurses. It's important to me to keep up the standards of care for patients. And we think that we are concerned that this bill will lower that standard of care. It could be used to direct students into abortion training programs, which are funded by the training fund, which was provided by the Abortion Care Access Act of 2022. Medical scarcity in abortion practice is a matter of medical ethics, not provider scarcity. Again, 9 out of 10 OBGYNs refuse to commit abortions because they recognize the scientific fact that a human fetus is a human being. While this program might be a good program for bringing more individuals into the field of nursing, and I hope that it will, we do ask that you add an amendment to exclude abortion from this bill. And so let's not let this reimagined workforce development turn into a pipeline of workers for the abortion industry. With that, we do ask that for an unfavorable report on Senate Bill 774. If you continue with a committee, we ask that you invite a member of the American Association of Pro-Life Obstetricians and Gynecologists to be on the committee. Thank you.
Thank you very much for your testimony. There are no questions from the committee, so we thank you for your participation. And colleagues, that concludes the hearing on Senate Bill 774. That also concludes our bill hearings for today. We will take a brief break before a voting session.